Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. On behalf of the organizing committee, the Center for Tropical Medicine, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, in collaboration with WHO TDR, it's my pleasure to welcome you to the seminar, Advancing Evidence-Informed Policy in Southeast Asia Region, Yogyakarta, 29th of January 2024. Please give applause to us, everyone. And I would like to extend a warm welcome to the Dean of Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Professor Yodi Mahendra Datta, and the representative from WHO Southeast Asia Regional Office, Mrs. Manju Rani, PhD, who is joining us through Zoom meeting. And also, our distinguished speakers for this seminar, who are WHO consultants specializing in evidence-informed policy, Mr. Fadi El Jardali, PhD, Mr. Davi Mamlona Marquez Romeo, and Mrs. Tanya Kuchenmuller. Welcome to Yogyakarta, and please enjoy the city. And also, all of the participants, the audience in this auditorium, from the lecturers, students, and healthcare policy practitioners from various departments and institutions. And also, additionally, we are inviting representatives from significant institutions, including the Ministry of Agriculture, Republic of Indonesia, Coordinating Ministry for Human Development and Cultural Affairs Indonesia, ASEAN Secretariat, BRIN, WHO Indonesia, FAO Indonesia, Indohan, along with experts from numerous universities and diverse research centers and associations closely aligned with One Health and health policy. And some of them are participating through Zoom meeting and tuning in to the channel YouTube of Center for Tropical Medicine. Ladies and gentlemen, the Center for Tropical Medicine, Universitas Gadjah Mada, has been serving as WHO TDR Regional Training Center for good clinical practice, good clinical laboratory practice, good health research practice, and implementation research. Since 2008, we have been building research capacity through training and programs. And today, we come together to enhance our capacity to formulate evidence-informed policy, aiming to bridge the gap between research evidence and impactful health policies. Well, ladies and gentlemen, this seminar is a part of evidence-informed policy workshop hosted by the Center for Tropical Medicine, Universitas Gadjah Mada, in partnership with WHO TDR as a part of project titled Advancing Evidence-Informed Policy in Southeast Asia Region. Within this auditorium, there are 16 participants who will be actively involved in the workshop. And these participants represent the Health Development Policy Agency, Ministry of Health, BRIN, TDR Regional Training Center in the Western Pacific region in Malaysia, public health and policy practitioners from Universitas Gadjah Mada. Following this seminar, they will proceed with the workshop, which will continue until Friday. Well, ladies and gentlemen, to begin this seminar, we would like to invite the Dean of Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, to give the welcoming remarks. Please, Prof. Yodi, the stage is yours.
Assalamualaikum warahmatullahi wabarakatuh. Very good morning, everyone. On behalf of the Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, I would like to welcome you to our seminar on evidence-informed policy. We are organizing this seminar as part of our mandate as the Regional Training Center for Health Research, supported by TDR, the Special Program for Tropical Disease Research. Under that mandate, as has been mentioned, we've been building capacity for research across countries in Southeast Asia in different fields such as good clinical practice, good clinical laboratory practice, good health research practice and implementation research since 2010. And then since 2016, we've also hosted the TDR Implementation Research Postgraduate Fellowship. So we've graduated, I think, about 80-something master students across the regions. And so we've contributed to certain extents to strengthening research capacity for disease control in Southeast Asia through those capacity building in terms of research. But we realize, of course, that these capacities for research does not automatically or does not guarantee translation into policy or to strengthen disease control programs, because as we all know, there is a big gap between evidence to policy. And there are significant challenges, barriers to translate evidence to policy. And that's why we would like to embark in the coming years on this new journey, on this endeavor, to expand our portfolio of capacity building, not limiting to just research capacity building, but also to build capacities of countries in the Southeast Asia region to be able to translate evidence to policy. And that journey is going to start today. This is the seminar which will be the launch of that initiative. It's going to be a long journey, and we have great partners to work with us. We have the WHO Evidence to Policy Unit, which is called by Tanya. I think Tanya will speak more about the unit later on. And we have colleagues like Fadi Dafi, who is here with us, who will be helping us to build our own capacity before we disseminate across the region. And we are really looking forward to invest more time and energy in this area and to complement our existing portfolio of capacity building for the region. So it's going to be a long but exciting journey, but every journey starts with a single step, and today's our first step. So I would like to thank WHO Evidence to Policy Unit and colleagues here for being with us and for working with us to take this first step. I would like also to thank WHO Southeast Asia Regional Office, who will be delivering a remark after me, also for the support and also for working with us to disseminate good research practices and in the future evidence to policy. And I would also like to thank our team here at the Center for Tropical Medicine for working hard to prepare for this workshop and also to prepare the team to be able to embark on this journey of evidence to policy. And last but not least, I would like to thank all of you, the participants who have taken your time to be with us today on this first step to this journey of building capacity for evidence-informed policy. So on that note, I would like to wish you a fruitful seminar. Let me rephrase that. Instead of wishing, let's together make this seminar fruitful. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Prof. Yadi, for the welcoming speech. Ladies and gentlemen, now we would like to invite Mrs. Manjurani, PhD, as the Regional Advisor, Research and Innovation, Southeast Asia Regional Office, WHO. She is joining us through the Zoom conference. Please, the time is yours.
Thank you so much, and thank you everyone from the university for inviting and making space for me. And I'm so sorry that I could not join in person, but Southeast Asia Regional Office will be represented by Dr. Takana, who will be arriving tomorrow and joining this workshop. So good morning once again from the cold and foggy Delhi. And I'm very pleased to note that this advancing evidence-informed policy in Southeast Asia is happening today at the Center for Tropical Medicine at Universitas Gadjah Mada. And as Dean mentioned, that this has been this regional training center for TDR since 2010. And I must extend my sincere gratitude to the center for undertaking several activities, including the TDR Clinical Research Leadership Fellowship, as well as the special program in implementation research in public health. This is a great contribution of the university to the whole region in improving the capacity of the researcher. And this training of trainers, capacity building workshop, is very timely and relevant, as we all know the volume of the research outputs produced in the Southeast Asia region continues to increase substantially in almost all the member states. You go to PubMed and you download like the research outputs in the last 5 years, and the graphs will be all going upwards. So we have a substantial increase in the production of the research. However, to reap the benefits of this increasing investments made on research in the region, these research outputs must be translated into 3 Ps. And these 3 Ps are products, policies, and practices, as articulated in WHO Southeast Asia Region Research Strategy 2018-2022. Further, these products, policies, and practices must be converted into public good that benefit public health. Means all the product and the policy, the benefits of these must reach the general population. As Southeast Asia, home to 29% of the global population, still bears disproportionate burden from many diseases such as tuberculosis, cervical cancer, or childhood malnutrition. So basically what we are saying is the research outputs are increasing. You take in any country in the region. Research investments are also increasing, though they are still not at a level where we want it to be, but still there's a substantial increase. But the benefits of these, whether the impact is increasing in the same proportion, that remains to be seen. So this process of conversion of research evidence or research output into 3 Ps and the global goods will never be linear or will continue to be affected by many external factors, including the socio-political context, organizational capacity, and resource availability. In addition, research output will not always be unbiased or credible. It is not as we like them to be, as highlighted recently in an editorial published in British Medical Journal that said that 85% of the research outputs are of no use, but just research waste. So people who are using it, the policymakers and all, they should be able to appraise the research evidence before making use of it. So in this context, we need to build capacity of the researchers, knowledge brokers, analysts in acquiring, assessing, adapting, and applying the research evidence to the particular socio-economic context of that country. And finally, the policymakers may not find time to go through the detailed scientific papers. The evidence may be scattered through multiple research outputs. There may be multiple research outputs on the same issue, providing conflicting evidence. So we must build capacity of the researchers, knowledge brokers, to objectively synthesize these scattered evidence into actionable points through evidence brief for policy, and to engage in policy dialogues and develop formal knowledge translation platforms. So I'm really happy today that over the next 4 days, this training of trainer or TOT workshop is addressing both these issues, building capacity in using tools for conducting situation analysis, conducting, finding, and interpreting science systematic reviews, and developing evidence briefs for policy. I hope this advice workshop will lead to capacity strengthening of regional training center and other participants in methodology and use of evidence-informed policy-making tools, which in turn, as a regional training center, would help build capacity, similar capacities in different member states of the region. We look forward to working with the Regional Training Center in coming year to conduct similar workshops in other member states in the region. With this, I thank the Dean, the Honorable Dean of the University, all the participants in the workshop to organize this phase 1 of advice workshop. And I wish all the participants a very productive and successful meeting. I wish I could be there, but I hope in the coming workshops when we organize in the other member state, I will be actively participating with you as well. Thank you once again and all the best.
Thank you very much, Mrs. Manjurati, for the welcoming speech. And now, ladies and gentlemen, we come to the most awaited moments. And please join me in welcoming our distinguished moderator for today's seminar. Dr. Rabika Yahya, MSc, will guide us through the seminars and discussions. After serving as a frontline healthcare worker during the COVID-19 pandemic, she pursued her master's degree in global health and development at UCL as a Chevening scholar. Recently, she interned at WHO headquarters Geneva in 2023 and currently leads the M72 tuberculosis vaccine clinical trial at Persahabatan Hospital, Jakarta. Without further ado, please welcome Dr. Rabika Yahya.
Thank you for the warm welcome. Good morning, everyone. It's a pleasure to be here today guiding our discussions on evidence-informed policy. This morning, we will learn about Introduction to Evidence-Informed Policy and EVIPNet, what is evidence and knowledge translation, learning from success stories of EVIPNet member countries, as well as bearers and facilitators to EIP. Now, without further delay, let me invite our distinguished panelists to the stage. Please give a warm welcome to Mr. Fadi El Jardali, Davi Romaro, and Tanya Kunchemuller. Firstly, I'm honored to introduce Mr. Fadi El Jardali, PhD MPH. Fadi El Jardali is a renowned global health expert and advocate for public health systems. As a professor of public health policy and systems at the American University of Beirut, he has published over 150 peer-reviewed articles, several book chapters, reports, and over 100 knowledge translation products on policy priority areas. He is the recipient of Global Health Leadership Award, the founder of the Knowledge to Policy Center, and has played key roles in various health organizations, including his recent nomination to the U.S. National Academy of Medicine in 2021. He is dedicated to evidence-informed policymaking and is the founder of the Government Engagement Platform, working to strengthen the role of evidence in shaping public policy. Let's give a warm welcome to Mr. Fadi. Our second speaker, I'm pleased to introduce Mr. Davi Mamblona Marquez Romaro, MPP. Davi Romaro is a consultant at the WHO Evidence to Policy and Impact Unit. He is a co-founder and former deputy executive director of the Verides Institute, the first Brazilian NGO specializing in evidence-informed social interventions. Davi has also worked as research coordinator at the Brazilian Ministry of Justice and as a research consultant at the International Initiative for Impact Evaluation and at the Center for Effective Global Action, UC Berkeley. He holds a Master's of Public Policy from the University of Oxford and a Master of Science in Social Psychology, as well as Bachelors of Arts in Psychology from the University of Sao Paulo. Welcome, Mr. Davi Mamblona. And our third speaker, I'm honored to introduce Ms. Tanya Kunchemuller, MA MSc. Tanya is currently coordinating the Evidence to Policy and Impact Unit in the Research for Health Department and Science Division at the WHO headquarters. She coordinated the Knowledge Management, Evidence and Research for Policymaking Unit at the WHO Regional Office for Europe. She initiated multiple regional networks such as the Evidence Informed Policy Network, Health Evidence Network, as well as European Health Research Network and others. She also led the WHO initiative to estimate the global burden of foodborne diseases at the WHO headquarters. Prior to her career at the WHO, Tanya worked for several years in the area of HIV and AIDS, for the UNDP in New York, and for the German Development Service in Mali and Germany. Welcome, Tanya. Let's give a warm welcome to Tanya as well. So thank you for joining us in Yogyakarta. We are so pleased to have you today. I understand some of you arrived on Saturday, and some of you arrived last night. You arrived last night, Fadi. Maybe you can take the microphone. How's Yogyakarta treating every one of you so far? It's been rainy, I understand. Maybe some of you have explored the city a little bit.
Well, thanks. First of all, is it on? Yes. Thanks so much for the warm welcome. It's really a pleasure being here at the Gadjah Mada University for the first time. We have been collaborating a lot with Dr. Yodi on various evidence to policy activities and initiatives so far, but being here and being able to provide the training of trainers and the concept in the context of the ADVISE project is really an exciting new step for us to be able to work with the Regional Training Center here in Indonesia for the Southeast Asian region, but also having colleagues from the Regional Training Center of the Western Pacific here to allow us to start this journey together that Dr. Yodi was talking about, and really embarking on the first step, but hopefully taking that journey to its completion. We from our side are very happy from the WHO Evidence-Informed Policy Network to be supporting technically this endeavor with the financial support, as was already mentioned, of TDR, the special program on research and training in the area of tropical diseases. So hopefully with that combination and the different factors and the different actors involved, we're going to make not only this workshop that we are commencing today to a success, but also this entire journey. In terms of the limited experience I've had so far in Indonesia, and I need to say it's my first time that I'm in Indonesia, it has been a really pleasant experience. People have been extremely, extremely friendly. Everything has been working extremely smoothly thanks to the excellent organization of Yodi's team here at the university. We also had yesterday a bit of time off already discovering the cultural heritage, which was truly impressive. And we look forward to the week together.
I'm so happy to hear that you have a nice time. Thank you. And what about you, Fadi?
Thank you. Thank you so much. My pleasure, in fact, to be in Indonesia. I have to say this is, again, like Tanya, this is my first time in this beautiful country. I've heard a lot about this country from many people, but we had also interesting experience and working relation as well with many people as well in this university before. So it really has been a pleasure. I have to say I have missed the opportunity to come earlier, although the team from EUB was actually visited, I think, Indonesia before and heard a lot about about this country. It's a long trip for me, I have to say. So, but it's worth it. So I have to say it's definitely worth it. Very much looking. I haven't really been able to see anything yet. It's my first trip outside the hotel because I arrived last night, but I'm certainly, hopefully, will be able to learn more about the culture and get to know more about the people, which I agree with Tanya has been really extremely nice. It's fascinating, by the way, and very strategic, very, I would say timely that this university is more, I would say, starting the engine of being the, a regional training center and trying to provide support not only within Indonesia, but also in the region. A lot of potential. I think the work, and we will hear more about it today in the next few days, the work that IFITMET has done in WHO that Tanya already mentioned has been really instrumental in supporting many centers, many institutions, many government and non-government institutions in many countries in the world of promoting the use of evidence in policy. You will see from the work that has been done so far in many countries that this is not theory anymore. It's not an abstract when we say evidence to policy. The question is really how to actually put the right institution, the right team, the right capacities in place in order to have really a better and much more impactful policies. The nice thing about the work that has been done over the last, I would say, almost 2 decades, a lot of success stories, a lot of impact stories. And I think Indonesia would be in this university at the training center, working with different countries. There is a lot of things to tap into. There's a lot of successes and lessons learned that one can actually harness to take it to the next level. So I'm so happy to be part of this work. Again, we had a great working experience before with a team from this university, but certainly now in the capacity of working with EVIPNet to support this even at the regional level. And there is a lot of a huge opportunity, and I'm happy that this university has taken the lead on that. Thank you.
Thank you so much, Fadi. And yes, we're looking forward to start the engine in Southeast Asia. And how about you, Davi?
Thank you. Well, I just can echo what Tanya and Fadi have already said. I think it has been, of course, a very short stay in Indonesia so far, just a couple of days, but really amazing and fascinating to see both the cultural heritage and how welcoming and friendly, and such a nice experience to be here with all of you. And I'm really excited about being able to have these discussions around evidence to policy, evidence-informed public policy and health policy. I think this is a very powerful debate, and it's really exciting to see that it is growing worldwide and here as well. So I think this partnership with EVIPNet can be a very instrumental and catalytic relationship to strengthen these partnerships in the region, and fortunately, or hopefully, provide input for better policy making and more social impact. So it's really a privilege to be here with you all. Thank you.
Thank you so much. Well, without further ado, I will give the floor to Tanya to deliver the first topic.
Okay, so we have foreseen now for the remainder of the morning session a series of interventions. I will be talking first about evidence-informed policymaking in general and provide some further background on the WHO Evidence-Informed Policy Network, EVIPNet. I will then hand over to Davi, who's giving a bit more of a background on evidence, different types of evidence, what evidence is, and knowledge translation. And then Fadi will speak more about specific country experiences. He already mentioned the long-standing experience we have with EVIPNet in various countries, but also about barriers that certainly exist when it comes to the uptake of evidence and policy, and also opportunities. Yeah. So let me get started. And one of the first things I wanted to briefly allude to is giving, in terms of background, a bit of a conceptual understanding what actually the term evidence-informed decision-making or policy-making is. And I know Davi will also be talking about it a bit more in detail, but what I want to outline here is that for us, evidence-informed decision-making has various components. So first of all, as you see on this slide, it's a systematic and transparent process. Yeah, really important to remember, because we do see that evidence is used in many different situations, but sometimes it's rather symbolic or it's cherry-picking of studies. What we want to see is this transparent and systematic process. And also that there are different kinds of evidence out there. There's research evidence, but also, as you can see on the slide, very important for decision-making processes is modeling or the outcomes of evaluations, just as the tacit knowledge, so the knowledge that citizens or stakeholders have that we need to take into consideration when you think about decision-making. And then again, the kind of evidence that one uses depends on the phase in the policy cycle that one is at. If you want to identify a policy priority, you rather look at data analytics. If you want to consider and identify what are good implementation considerations of policy options, you would rather refer to implementation research, right? So it's a complex undertaking. Just as important are the 2 points that you see underneath of the text box is the local contextualization. So the adaptation of the evidence to the local settings and groups, which are at the center of the decision-making process, and the engagement processes with stakeholders and citizens to allow for the legitimation, but also the relevance of the evidence. And you can find more about this in the publication that you see projected here, the Evidence Policy Impact Guide that we developed, which really gives you insights into what evidence-informed decision-making is about, what resources are out there, and also what kind of tools and data bases you can access. I will speak about this tool a little bit more on a slide later on. So having given that brief conceptual background, what is the evidence-informed policy network that we have been alluding to already? So as Fadi mentioned, the experience that we have with this network is close to 2 decades old. The network was launched in 2005 upon request of member states at the World Health Assembly. So at the World Health Assembly, member states requested WHO to put in place an innovative mechanism bridging the gap between evidence and policy, and that was then as a consequence, EVIPNet was created. And again, you see here the emphasis on promoting the systematic use of evidence. That is the ultimate aim, in fact, of the network. But beyond this kind of promotion of evidence use, we also want to make sure that capacity is being increased at country level. So it's not about WHO undertaking knowledge translation activities. It's for us to catalyze and increase capacity at country level. And beyond country capacity building and putting countries into the driving seat, what we'd like to see happening is that the capacity is being institutionalized, so that structures and mechanisms are being put at country level in place, allowing for a more sustained interaction between researchers, policymakers, civil society, to allow for evidence-informed decision-making. And then EVIPNet is a network of networks, and what we mean by that, you can see it on this slide here, is that we are really operating at the 3 levels: at global level, at the regional level, at country level. You have heard from our colleagues in the Southeast Asian, so in the ASEARO office, in our regional office, that they are the direct counterparts very much of Indonesia and other countries in the region. So our regional offices are there to support countries with the capacity building, support countries with, as necessary, adapting some of the tools to the regional cultural context. But the nodes of the network, that's really what happens at country level. So at country level, teams are operating that allow for the knowledge translation processes to be planned, to be implemented, to be monitored and evaluated. And it's with those teams that we as EVIPNet are directly working with. But it's not only that WHO with the regional offices and headquarters are working with the teams, it's very much also that the teams are interconnected and exchange experience, peer support each other. That happens within regions, but also across the different regions. So the beauty about EVIPNet is really that we have, on the one hand, these horizontal lines of communication, support, exchange, and at the same time, the vertical ones where WHO headquarters, the regions, but also the country offices are then supporting country teams. Yeah. And we are working in more than 50 countries globally, with a particular region emphasis in the WHO European region, the Eastern Mediterranean, the Americans, and also the African region. But again, we are so pleased to see that also in the 2 Asian regions, there is increasing and nascent interest, and we very much would like to see the kind of community growing also in the Asian region. So the network is set up for this kind of expansion, and again, for this kind of support from other network members and from WHO. And in the context of the structure, I'd also like to really stress, I mentioned it very briefly, but we have a global steering group of EVIPNet, and Jody has been so kind to support us in the global steering group for quite a while now. So we have the representation of this region on our board, and again, we'd love to strengthen collaboration with all of you, including additional countries in both the Western Pacific and Southeast Asia. What we have among EVIPNet, and that was launched in 2021 at a global summit, Global WHO Evidence to Policy Summit, is a call for action. There are 4 different areas that we are moving on with, and what I will be doing in the next few slides is highlighting a little bit more on what we have done in the 4 different strategic domains you see on this slide, to also, again, underline and how far members of EVIPNet can benefit of the movement, and which are actually the core areas that we embark on. But you see the institutionalization being emphasized again. It's really about creating the structures and the support mechanisms that allow for a more continuous use of evidence in decision-making processes. Just as important is, apart from the institutionalization efforts, is that high quality norms and standards are being put in place, that there are tools out there that guide the process, that allow then for not only the tools to be high quality, but in particular the knowledge translation activities at country level to follow certain standards and again have a certain level of quality assurance that is required to allow for credible activities informing decision making. Thirdly, EVIPNet, I mentioned already, is about capacity building, is about training, allowing for peer support, mentoring. And then fourthly, we also need to ensure that there's access to useful and relevant evidence, which can then feed into the decision-making processes. And while we have launched in 2021 the call for action, we have partner institutions that went down a similar path of publishing and recommending policy actions, but in a slightly different and in that sense complementary way. So we're working very closely together with Cochrane. Cochrane more looking at the evidence generation, where they had identified certain recommendations, again, that complement our activities, just as also the Evidence Commission. The difference between EVIPNet, which is an initiative focusing a lot on health and policy, is that Cochrane, as I mentioned, more on the evidence generation, not the translation and uptake, and the Evidence Commission is multi-sectoral in nature. Yeah, and again, we're aiming to join efforts and to speak with one voice, keeping in mind that we're all aiming for the same a vision where evidence is more systematically, transparently used and routinely used in decision making. So as mentioned, I will briefly walk through the 4 different domains of the call for action to highlight our key activities and to give you a glimpse of what EVIPNet is doing and again, the kind of support we can provide. Institutionalization is a term that is used a lot, that you hear a lot, whether in the context of evidence-informed decision-making or in different areas. But for us, the question really arose, how can we support member states in institutionalization? If institutionalization is an aim, how can we allow for giving additional assistance in you walking or making the steps towards institutionalization? And here, we developed, based on a critical interpretive synthesis, 2 frameworks, which then fed into a new publication that came out last year, the WHO checklist. And those who will be part of the workshop, you will be hearing more about this checklist. We will walk you through how to apply it. For all others in this room who are interested, I'll invite you to have a look at this tool on the website, and we're very happy also to further discuss this either during the session today if there are questions or during coffee break. So institutionalization is definitely an area of emphasis of our general program of work, but then also developing tools, norms and standards for EVIPNet members, but also of course beyond. All of the tools are accessible on our website. Here again, the guide that I mentioned earlier, which is for us a key reference document because on the one hand, it provides an easy, understandable background. I call it an ABC of what evidence-informed decision-making is about. So you have a lot of the concepts, the theories, and how to move forward from a conceptual point of view. It includes this evidence ecosystem framework for impact that you can see on this slide. So it allows you to understand what different kinds of evidences there are, the primary, secondary, and also tertiary evidence. The tertiary evidence being the evidence that is most user-friendly and packaged in a way that decision-making makers can apply it most easily in their decision-making processes, while the primary evidence is our primary studies. And in that sense, not only there's a wealth of evidence, but as we have also heard from our colleague in CRO, the need for assessing it, appraising it, and understanding how to use it is much more diverse than if you use already pre-developed knowledge translation products in terms of the tertiary evidence. So the book, the guide, gives you information about that, but also how to then move through the evidence policy and action cycle and how to shape evidence, how to make use of evidence to allow for it to be brought to a level that is most applicable in the decision-making process. So that's very much core of the tool, but also a toolbox is available, as well as a repository of all WHO tools in the context of evidence-informed decision-making for you to have an easy access to it. And beyond this guide that I just mentioned, there are a diversity of other tools that we'll be using quite a bit during the workshop that you can find on our website. WHO is continuously looking at identifying new needs when it comes to instruments, so that we really meet member states' requests and activities complemented with our tool set. Capacity building, that's what we are very much going to do within this week. On this slide, what I want to emphasize is that beyond this week, so it's not only about training and transferring of skills as well as knowledge, but what we like to see is that beyond a week of training, we are there for coaching, for providing additional assistance, for setting up mentoring through us, but also again through other EVIPNet countries, so that we, beyond skills and knowledge transfer, create motivation, but also an environment that allows you to continuously apply your tools and give you also a setting where beyond applying it yourself, you feel having the capacity of transferring the skills that you've learned to others, right? The trainers. So that mechanism then leads to specific knowledge translation products and evidence brief for policy, for example, and that can be applied in different areas. I'm highlighting here antimicrobial resistance, as this is an area we have a strategic partnership with also in this region, with the International Vaccine Initiative, with a project called RADAR, but it's agnostic. Our work is agnostic, and we would really like to hear from you what kind of policy priorities you're facing, and which we can then address in our evidence to policy activities. What we'll be hearing more about throughout the workshop here is this policy action cycle that we'll be going through. So the capacity building is looking at identifying a policy priority that needs to be addressed at country level, then seeking the relevant evidence where we have the related tools for, summarizing the evidence, but then also allowing the evidence to be complemented by tacit knowledge, to have deliberative engagement processes, the policy dialogue and citizens engagement. Again, tools that we will be highlighting and going through with you within this week. This is also complemented by situation analysis, so apart from the policy action cycle, for us to better understand what exists in your country already, what kind of actors are engaged in the process of evidence to policy, where strengths and weaknesses that we can jointly address. So this is part of the capacity building. But then I mentioned also the access to evidence is an important point when we think about evidence-informed decision-making. WHO is a global organization developing global norms and standards. So access to evidence is very much assured by our organization and through various departments at WHO, but also Cochrane that I mentioned earlier is an important organization looking at developing global evidence goods. In the guide that I mentioned earlier, the Evidence Policy Impact Guide, you will also be given a variety of sources and databases where you can access evidence that is already curated and at a level that is easier to use when you think about knowledge translation processes. So again, have a look at that guide if you wanted to identify which databases are reliable and at the same time important sources such as health systems evidence in the context of knowledge translation. Lastly, why not really one of the four strategic domains of the call for action that I've been going through on the slides beforehand, but is our mandate in creating awareness, learning, and commitment. Here you see an excerpt of the Evidence to Policy Summit that we organized in 2021 that I mentioned already. Last year, again, we had a global summit, and the next one is coming up in 2025. It will be organized in Brazil with the Ministry of Health there. So watch the space also for these kind of awareness-raising activities at global, but also at regional level. In parts, it's also linked to a high-level political engagement. So, for example, in 2021, We had keynote speakers such as Angela Merkel, the Chancellor in Germany at the time, or Ban Ki-moon. So yeah, that's a quick run through of what EVIPNet is doing, and again, what you as being engaged with the network can expect to be benefiting from. So thanks very much. And with that, I'm going to hand over to the moderator again.
Thank you, Tanya, for walking us through the EVIPNet, because I think not many of us have really looked into what EVIPNet is and how wide the network is. And also you mentioned that it is already established in 4 WHO regions, and CIARO and WIPRO hasn't really been involved much in it yet. So hopefully we will go into that, because we have WIPRO and CIARO people here. Okay, you want to open discussion, or we can go to the next speaker? You can go to the next speaker? Okay. I give the floor to Davi.
Thank you. Can I have these slides as well? I imagine it's not up yet. There. Thank you. Well, thank you again for the opportunity of being here. It's such a pleasure. And I will be trying to lay the groundwork for the basic concepts of the debate so that we can move forward within the workshop here and also in future partnerships. So the key questions that I will be addressing are what is evidence, what is not a translation, what is the role of the policy-making process, especially with the focus of evidence, and finally, what is evidence-informed policy-making, right? And I will also be inviting all of you to contribute to this conversation. Hopefully you can help me, for instance, define what is evidence. So what each of you understand as evidence. Can someone provide me a definition? Facts, okay. Any other definitions? Cool. Data, data. Someone else? Systematic reviews, yeah, okay, thank you. Yeah, that's great. So evidence is a very polysemic word, right? So you have multiple meanings, and it's used in very many different contexts. So you can have a very broad definition, such as the one that we're displaying here now, of evidence concerns facts, actual or asserted, intended for use in support of a conclusion. So basically, any idea, fact, assessment that you can use to support a conclusion can be considered a type of evidence. But of course, we are here talking about a more specific type of evidence. We want to talk about research evidence. And the reason for that is because we really want to provide high quality input for decision making, especially for policy making. And we want this policy process to be effective, efficient, and impactful, right? So we want the evidence used for decision making to be of really high quality, very precise, very accurate, so that these processes are effective. And for that, it's really important for us to consider the different types of research evidence that can be used in the policy-making process. It's a bit small to see, I think, but basically here it's a funnel that it's taken from the guide that Tanya has mentioned before, where we present different types of research evidence organized in terms of the use we can have for them in the policy-making process. So the first layer of the funnel refers to primary research. That would be empirical research that produces data relevant for decision, relevant for understanding a problem, relevant to understanding the effectiveness of an intervention. And this is more traditional, like the empirical data that academia will develop, right? So this is the traditional output of research evidence. Then the second layer refers to evidence synthesis. So this is the process of using this primary research, this empirical data that has been produced, and synthesizing it, making sense of it, appraising the quality of it, so that we can have a more refined, a more generalizable conclusion based on the research that has already been produced. So that's a second level of making the research evidence more applicable and making sense of the diversity of evidence that we have. So the primary evidence will be very general, will be very vast, and the evidence synthesis will try to synthesize that so that if someone is trying to answer a research question or a policy question, they can have a summary, a high quality very accurate, very precise, very trustworthy summary of that primary evidence. And then finally, we go to the third level, which would we call evidence products, which should be already the process of converting that research evidence into products, into strategies that are tailored for decision making. So, for instance, the evidence-based for policy, which we'll be discussing during the seminar, the workshop here, guidelines. These are products that already bring the evidence to the context of decision making and provide additional information, contextual information that will allow us to move forward based on the research evidence, based on the primary evidence, towards high quality decision making. And the point here is that we really want to provide, as I was saying before, the opportunity for decision makers to make the best possible decision, right? So that means that we don't want any type of evidence to be considered the same way. We want the different types of evidence to be assessed based on its quality, the risk of bias, to what extent they are accurate and precise. So we really want to make the point that not all evidence is equally convincing, and we need to produce evidence that is really produced through a process that provides precision, reliability to the conclusions. And for instance, that means that scientific evidence has a higher quality, it's more trustworthy than direct observation. Yeah, if you think of a lawsuit, if someone witnessed something, that is considered a high quality evidence. When it comes to research evidence, that's not high quality. That's very basic research output. We really want to pass this evidence through a process of checking of reliability so that we can really use it as an input. And that all boils down to the process of assessing the quality, the trustworthiness of the evidence you're going to be using for decision making, right? So we really want to make sure that the policies we are supporting, they have access, or the policymakers that are developing these policies, they have access to high quality, very precise and accurate evidence for decision. Okay, next key concept is knowledge translation. That has been already mentioned here a few times. Does anyone know a definition or would like to try out, attempt a definition? Please.
Apply the knowledge from
Thank you.
research into policy making.
Can you repeat it?
Pardon?
Can you repeat it in the mic?
To apply the knowledge that you gathered from research into policy making.
Yeah. Any other definitions? Okay. Yeah, that's definitely knowledge translation. And knowledge translation is a bit broader than that, right? So it's a process as defined here, it's a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to yield beneficial outcomes for society. So when you talk about knowledge translation, we're broadly talking about the process of bringing technical scientific knowledge into applicable opportunities for society. So evidence-informed policy will use knowledge translation as a tool, as a strategy, so that policies can be informed by the best evidence. And knowledge translation is a key part of this discussion that we're having today and throughout this week, because basically, as we were saying before, we have this wealth of resources that are available at academia, super precise, super high quality, that has been matured through decades of research and discussions around academics. And this wealth of resources are often underused by society. So we have many decisions, many institutional processes that are taking place throughout society that could be highly improved, and we are missing out on that opportunity because we have not invested as much as we have in research. We haven't invested as much in the process of really using that research to improve the social processes where research is relevant, right? And that includes practical applications such as clinical practice, and also the policy application of policy making, policy evaluation, policy implementation. So evidence-informed policy making is exactly the process of using this rich wealth of resources that academia offers to make better policy, to inform policies so that the policies are more accurate, more precise, and more ultimately impactful and relevant for society, right? We really want to ensure that decision making is well informed before it takes place. We want decisions to be to have decision makers have the opportunity of assessing, of understanding, absorbing what the research output says about the problems they're facing, so that they can make better decisions. And as Tanya had mentioned, that's only possible if we do it in a very systematic and transparent way. So by systematic, we mean that it follows a very clear protocol of how this research evidence is going to be converted into an input for decision making. We really want this to be standardized and rigorous and precise, as the research and academic field demands. And we really want to be transparent so that anyone can assess what has been done, the weaknesses, the potential biases, so that this process can be reproduced as well. These are core principles of evidence-informed policymaking that come from the reliability, the need for precision that research demands, right? And another key part of this debate is what the role of evidence in policymaking process. So as Tanya had mentioned, we don't expect policymaking to be only a copy and paste from what research says. We understand that policymaking is a very complex social process, a very complex institutional process that needs to take into account, and that naturally takes into account, it's unavoidable, different factors, different processes and social streams, such as the influence that pressures group we're going to have in the policymaking process, the policy narratives that frame a problem, that provide an overview of what's possible, the window of opportunities that a policymaker has when they are making a decision. What are the available resources that we have? What is the budget? What are the infrastructure? What are the technical skills of the team that are involved in the policymaking process? Values, what are the values of the society that we are working on? And so on. So like the experience, the expertise, tradition, these are all factors that will be part of the decision-making process, and that's really part of it, and it's a valid part of it, it's an important part of it. And we don't want evidence to replace all of that, right? Evidence needs to compose with all of that so that decision makers and the groups that are part of the decision-making process can make better decisions, taking into consideration all these factors, but also what the evidence says, or what the research evidence says about the problem that we're facing and how to address it. So, for instance, we do want decision makers to consider that a few interventions might be the most effective for tackling a specific health problem, but we also want them to understand that maybe the most effective interventions will not be accepted by the society or the group that they are trying to target, because of the policy narratives, because of the social narratives that are around that problem. And the decision makers will have to make that balance, this consideration on what could work in that context, given the values of the population and also what the research evidence suggests that might be the most effective, right? So globally, the most effective intervention that has been proven to be super effective and that it's really the best approach for that case might not be the best approach for your specific case because of local barriers, because of local needs that might be more urgent. So the idea of talking about evidence-informed public policy is exactly that. We want to avoid the misunderstanding that policies need to be a copy and paste. So when people talk about evidence-based public policy, that is a common misunderstanding that we really want the policymaking process to be super reliant and really focus on what the evidence says, which could lead to this problem of ignoring the other factors. So we really don't want to ignore the other factors. We want to make sure that all these factors are taken into consideration, and that's why we emphasize the word informed. We want the evidence to be available and to be considered in partnership, in combination with these other factors, and not for the evidence to be just applied directly without consideration of these other factors. And that is an important caveat because it is common for researchers to be very frustrated because decision makers have just ignored the research findings. So the researchers go through like this 5 years process and they find this very compelling evidence, and then they go and present it to the decision maker as the truth about what is going on, and then the decision makers just don't use it. And they often don't not use it because exactly they need to account for that so many other factors that researchers are oblivious to, right? Because if researchers are focused on the policy or the research question that they had been engaging with, while the policymakers are really engaging with society, engaging with the budget, engaging with the higher levels of the political system. And that just copying or applying that research output often will be unfeasible. And that leads to a very interesting discussion that we can have maybe in another moment, which is how researchers can be mindful of that and be strategic about how to present evidence for decision makers. So how can we take into consideration that the fact that decision making, policy making, institutional development, capacity building is not math. It's really navigating a very complex labyrinth of vectors and factors and clashes of social needs and priorities and interests. And how can we map out these factors and infuse evidence through the process so that these processes become more reliable, more impactful, without denying the fact that it's still going to be a labyrinth, it's still going to be a super complex process, that research will not like overhaul the whole thing. You know? Yep, so coming to a conclusion, we really want, as I was saying, evidence to go and to be infused through the process of decision making. So we want evidence to be a huge part, a central part in the process of establishing a social agenda, a political agenda, in the process of defining what would be the priority problems for any mandate. We want evidence to inform the analysis of these problems so that we can have a better understanding of what are the causes, what are the magnitude of the problem, what are the main consequences, the trends, and also how can we act on this problem. So what are the best strategies to deal with them, how to implement these strategies, how to learn from this implementation process so that we can improve it, we can perfect it, how to evaluate these interventions so that we can disseminate it, scale it up. So we will look at the policy cycle, which is a very complex cycle, and try to incorporate evidence into all stages, into all steps, through all points of the cycle. Again, not trying to deny the other complexities that are proper, that are specific for the policymaking process. Here we depict, just for reference, the policy cycle that comes from the EIDM guide that Tanya had mentioned before. And the policy cycle is a mythological cycle, right? It's not really how policy making happens, but it's an interesting heuristic to think about the different phases, or maybe better said, the different dimensions of policy making. And in the guide that Tanya presented, we will provide you with tools to infuse evidence into the different stages or dimensions of the policymaking process, right? So that we will start with the agenda setting, identifying priorities, and then how we can infuse evidence into this process, then defining a problem, understanding the problem, the tendencies, the magnitude, identifying potential solutions, what might be the most effective interventions for that specific problem, what might be the interventions that work best given our contextual needs and contextual capability. Then how to communicate and engage different actors so that this problem has traction and these interventions can be really effective, because social policies, health policies, they don't work in a vacuum. They really work embodied in the context, in the health system and societal system where they are implemented. So we really need buy-in, and we need negotiation and interaction between all the key stakeholders. Then the whole process of implementing, assessing, monitoring, learning from the implementation, adapting, and improving the policies that we're developing, ensuring sustainability or achieving sustainability, which is often like a huge challenge for any policy. Evaluating the policy, disseminating it, looking for opportunities for scaling it up, and then back to the problem definition, agenda setting, right? Again, decision making and policy making is never that linear. The arrows there in the middle, they point to the complexity. Many of these stages happen overlapping or at the same time. Some of these stages are sometimes just completely skipped, and then people go back to them. But these dimensions are always present, or they can be present, and we really want to infuse evidence through all these phases. And for each phase, different types of evidence products, of evidence strategies and knowledge translation strategies will be more applicable or more relevant. And we want to be, as knowledge brokers or knowledge translators, we want to be savvy about this. We want to understand throughout the policy cycle what are the different policy questions that are being asked that we need to answer. What are the counterpart research questions that these policy questions refer to, and how to answer these research questions in a way that is applicable and useful for the policymaking process, right? We don't want to just create new research output that can be published in a journal, but we really want to provide answers that are in line and that are embodied in the policy system, which means that they need to understand the contextual factors, they need to be tactful about how to present and how to create this evidence. And I think this seminar today and the whole workshop for this week is an invitation for you all to contribute with this process. It is not new, but still growing area, this area of evidence-informed public policy and knowledge translation, for which you really need support. We need more people working on it, both disseminating these tools, applying these tools, and reinforcing the capacity in different countries and institutions to do it better, and also developing these tools or developing new tools that can be relevant for the many challenges that knowledge translation imply. So evidence-informed public policy is not a solved problem, right? It's not something that we have sorted. It's really a challenge that we are facing. We have here a wealth of resources and many tools and strategies that can be applied, and we invite you all to get acquaintance with these tools so that you can provide these answers to your institutions. And we also would like to invite you all to help us developing these tools further, because there is definitely so much yet that we need to do. And the challenge of bringing research evidence into decision making, into policy making, into practice is still a huge challenge for us all. So please help us all. Yeah? I think that for the benefit of society in general, it would be really great if we could count on all of you to support this process. Thank you.
Thank you for the wonderful presentations, Davi. I saw a few nods in the audience, particularly in the section when you talked about that not all policies will apply the evidence or research. It depends on the context and depends on other factors, like such as interest and so on. So I think we might have an interesting discussion later with the audience regarding that section. Okay, next, I give the floor to you,
Sure.
Fadi.
Thank you. We have the Assalamu alaikum wa rahmatullahi wa barakatuh. So thank you so much. I think I have to say that Tanya and Davi had made actually my job much easier now. It's a presentation because you mentioned a lot about it. So what I wanted in my presentation, in fact, and discussion, more of a conversation, to be honest with you, just more of a tell you a story, because I believe that I think part of the thinking, I think all of us here, we have I would say, leap of faith that we would like to see a world where evidence is part and parcel of every decision being made in governments, in public policy, in health policy. That's the leap of faith. The question is how we can take that leap of faith to a value proposition and to create a system and a product that governments can use. And I have to say, I've been working in this space for more than 20 years. I have to say that one of the things that I've learned that when we talk to governments, don't talk to them about convincing them about evidence to policy. Tell them I'm here to give you solutions. I'm here to help you find a solution to complex problems. I still remember when we launched, which was part of IFNET, when we worked in the center K2P, and we were trying to actually make a value proposition to government. I still remember when I went to meet the Minister of Health. This was way back early 2014. Was like trying to convince him that evidence, etc., etc. And he surprised me by one question. He said, "Look, all what I want from you, shall I go and pass the law for salt fluoridation in Lebanon or not?" So he was so much about what's in it for me. There was a problem at the government at that time. Shall we issue a law related to salt fluoridation, putting fluoride in salt because to deal with the tooth decay of young kids in Lebanon and vulnerable population. Why I'm saying this? Because really is to make that pitch to go from a policy nudging to a real institution of using evidence and policy, you need to be convincing policymakers that I'm here to give you solutions. When I was looking at the Indonesian healthcare system, I realized that you have universal healthcare insurance, and I was discussing with Professor Yodi this morning, but there's an issue about equity, there's an issue about access, there is an issue about capacities, and interestingly, Indonesia, correct me if I'm wrong, that after COVID-19, the government made it very explicit that you want to invest in primary care, in preventive care, in quality of care improvement, whatever, which means there are some emerging priorities. The question is to what extent those priorities are being in a way informed by much of the evidence that is coming from this reputable university and others and worldwide. So it's really about how to take that leap of faith to make it an institutionalized products from this. So that's why we are meeting today, that's why we're here this week, is that how we can take this forward. As I mentioned, there's a lot of more than 2 decades of work that IVIPNet has done in all regions, by the way, in all regions. And I had the privilege actually to visit all the regions, including this region, because I was mentioning to Mark this morning, I was actually in Malaysia many years ago because of some of the work. But I've realized with time that sometimes people get excited about a new area or something that they want to do. But the problem is when they start that engine. That's why I mentioned start the engine and move it into an engine of growth. Sometimes we get so excited, we want to start, and then there's a pushback and we stay where we are, or at least we don't make a major impact. We've learned all this over the last 2 decades. That's why I wanted to mention that here you are privileged in the sense of we're going to share a lot of those experiences with you and those lessons learned, and maybe building on that so you can really take it to the next level and maybe avoid some of the lessons or failures that we have seen over the last few years, despite all the successes. And I always say sometimes learning from failures is more important than learning from successes, because this is how we can really try to move to the next level. So again, it's a conversation, and I want to have a more of a chat with you today also before we finish about some of the things that you see as also priorities or areas or maybe barriers, I would say. I understand that most of the participants are from Indonesia, but I'm also people that are joining online that also from the region. So feel free to come in as well to mention this. So I think this is not the presentation that because I put one slide. It's not in that presentation. Okay. Anyway, so if you don't find it, okay. Sorry. Now this is a bit personal, I have to say, and I decided to add this morning. Thank you for adding this slide. But I'll tell you why I put it. 2 days before I came here, I was telling my kids, and including my daughter, that I'm coming to Indonesia. And she said, I want to go with you, Dad. I said, no way, you have a school. It's a long way. He said, I know a lot about this country. I didn't know about this, actually. She told me I know a lot about this country. And I said, well, how did you know about it? He said, well, we did, 2 years ago, there was a big event, a cultural event in school. And they asked students to identify a country that they connect with. So my daughter read a lot about Indonesia, about the culture. And she decided to be with that part with Indonesia, and she's actually the one that is here, the far left. She was so proud that she actually dressed the Indonesian costume, and but I was amazed. I mean, I learned a lot about Indonesia from her, not only about population size, about religion, about this. So I said, look, Dad, you're not gonna come with me. I promise I'm gonna put this slide for people to know that's the story behind it. Anyway, it's funny how sometimes I learn a lot from my children, by the way. I learn a lot. So let me talk a little bit. I think what Tanya and Davi already mentioned about the learning and the impact that IVIPNet. So IVIPNet really has been, I have to say, a successful social movement, a policy and political movement over the last, I would say, I've been involved with IVIPNet since 2006, I have to say, but I've seen the progression of how we have started from thinking about a leap of faith statement of evidence and policy to a real action. And I think this region had a lot of potential to build on all those learnings. I wanted to also talk about our experience, personal experience at our center. The Knowledge to Policy Center was pleased and had privilege to engage with many people, including Shita and the team here at Medici University as part of the work that we have done over the last many years. But this center was also created part of the IVIPNet. And I wanted to show you that there has been a lot of entities and training centers and policy centers that was created as a result of IVIPNet, and now they are actually leading in their own field or leading in their own region. Interestingly, in my university, I have to say, so at our center, by next year, we're going to be more of a 10 years anniversary. Maybe this is the time we're going to get you actually to Lebanon. So the 10 years anniversary of K2P, but interestingly, the university decided, because of the work that we have done and the impact that was created influencing policy agendas in health and social sector, now we created, last month, the president announced it, which I will be leading. It's called GAP, Government Engagement Platform. So we're taking it from K2P to GAP. The K2P will stay for health and social sector, but now the university is making an announcement also that they will get involved in all public policy areas and trying to make sure that the evidence is institutionalized in all public policy. Just to show you, how important it is, and that's great that, this reputable university is taking the lead now in Indonesia and in the region. A lot of potential in terms of taking this forward. So again, when we talk about IVIPNet, I've been involved personally in supporting many teams as part of IVIPNet. And to be honest with you, the unique features, I would say features and products of IVIPNet, among all those manual that Tanya has actually presented and Davi, is that, IVIPNet was successful in building capacity of teams and countries at the level of identifying priorities. And in policies, priority change. Now you have an election, right, in February. I'm sure that there are a lot of political platform, a lot of political promises, and a lot of things on the agenda of the government. So priority change as a result of this. And you see in COVID-19, most countries, their priorities had changed after COVID-19. So IVIPNet has an interesting tool in terms of how to identify priorities, policy-relevant priorities. Second is really products. As I mentioned to you, that you could have a lot of value-based statement, but if you don't find a product, what that product? What would that be 1, 2, or 3 pages that you want to put in the hands of the policymakers to inform decision? That's why this workshop today, this week, it will be about evidence, brief for policy. What would be those? There's a lot of examples, successful stories now of how those products made it into the decision-making processes. A policy dialogue, I mean, one of the most common used tools in knowledge translation is policy dialogue. And policy dialogue is not a focus group. It's not bringing people around the table. In fact, it's a platform to bring all those stakeholders that have a stake on a particular problem, and they have a stake to find collectively a solution that they can all implement. So we're going to walk you throughout this week in the workshop about how to conduct successful policy dialogue, how to facilitate it, how to prepare for it. And I have to say, over the last many years, I've seen many governments now are making decisions, collective decisions based on policy dialogue as well. Certainly, IVIPNet over the last many years, there's a lot of documents, clearinghouse, observatories, centers, entities, platforms, units that actually have been very much engaged, but there's a lot of evidence, a lot of manual, all what has been being discussed about knowledge translation, all translated into an actual tool. So that's why, please, for the people that would like to build skills on that, always look at the manuals and the template that was produced by IVIPNet. Honestly, it's hands-on, standardized, action-oriented, no theories, okay? No, it's just really things. If you fill it in, you can make an impact. So this is really quite interesting. And I have to say, for the people, I don't know the mix that we have here in this room or online, but I tell you now, building capacities and skills in evidence-informed policy, it's a requirement. Even in School of Public Health, even in School of Medicine, whatever, now we teach students as part of the curriculum about how to develop those products. So it's not a luxury anymore. It's actually part of how we actually advance it. So again, I'm not going to mention about the manual, but I think she, Tanya did a fantastic job. And I have to give her credit because much of those manual templates were created because of your leadership, Tanya. I always say this because you were actually behind that vision of how we can actually help countries in a much more practical way. A lot of examples and of impact. And I have to say that, when we mention about how evidence was used successfully in policy, we see a lot of impacts, whether really about strengthening human resources to eliminate malaria, whether about strengthening health system in many countries, whether about reducing prenatal mortality, whether about lowering alcohol consumption, addressing antimicrobial resistance, improving community access to malaria treatment for children, reducing childhood anemia. And I give you a lot of examples. And I have to say, over the last many years, we've learned the hard lesson that we need to have a rapid response system. Now, many knowledge translation platforms now, they have rapid response. In our center, K2P, we have rapid response. And we learned the hard lesson from COVID-19. You don't have the luxury to tell policymakers, wait for me 3 months up until I do systematic reviews and I show you what the evidence will say. No. Decisions in government has to be done by yesterday. So you have to be well prepared. So that's why there's a lot of capacity that were created. And this is really just a small piece of the different impact that were generated over the last at least few years, particularly after COVID-19, because we've seen significant impacts related to this. Again, all these are manuals in terms of how to shape the agenda. There's a lot of work that has been done about antimicrobial resistance. I think most countries now, most regions that were supported by COVID, by EVIPNet, has produced evidence-based policy. I think most regions, I have to say. And most of them are successful. Now we have a way also to measure the impact of the using evidence in policy when it comes to this. Again, there was a lot of training program that is being done by EVIPNet, and this is really maybe the recent one from the radar, when it comes to antimicrobial resistance, but a lot of regional, national, and global training programs. And that's why, I think your leadership now at this university to take it to become really a regional training center is extremely important. And you will see demand, a humongous demand will come to you for more and more capacity. And this is really what we're trying to actually do this week, is that you will be really a hub, an institution that will actually support many entities. We've done that before, by the way. So it's not, I think that's the nice thing about it. So you're not starting this from scratch. You're starting it from really building on all the learning that we got over the last many years of being really a hub for this. But I have to say that, reflecting on, okay, what are the key learning that we got so far from all those exercises? And I have to say that the most important thing is that we need to start again by pre-assessment of the team capacity. Meaning, it's in knowledge translation, there is a saying called that don't eat your lunch alone. And why I say that it's all about the network. It's all about who you know. It's all about what you know in this country and how you can identify the right stakeholder around the table. So when we work when we create platform, when we create a functional country teams that promote evidence to policy, you need to bring the right stakeholder around the table, not necessarily on a daily basis. But what I mean by that, it's very important to assess capacities within your country or within the closer team or institution that you're gonna work with. If you think you're gonna be sitting in the office with 1 or 2 people and just working on all the evidence, creating a product and sending it to government, I tell you, you'll be disappointed that nobody will be reading it because you haven't done the right engagement and you haven't had the right networks to bring this forward. So that's why, and now in EVIPNet, there is a lot of assessment tool that is being used to assess capacities of country team and to identify gaps. By the way, for the workshop this week, we sent an individual assessment tool. I think 6 people already filled or so, which is fine. But I think this important tells you where do you stand. What are the areas that you need to invest in when it comes to this? Second is really involving stakeholders and policymakers right from start. Don't do all the work and then suddenly go to the minister or go to a parliamentarian or go to your regional government and say, look, you know, showing muscle and say, look what I have done for you. It's too late in the game. If you want to provide them solutions, you better understand their needs, you better understand showing them what's in it for them, and you better engage them in the process. And that's part of the knowledge translation mechanism. So engaging policymakers is very important. Navigating political system is very important. I have to say, I'll give you an example. If you look at systematic reviews, you can show that sin taxation is an excellent tool to generate more revenues that can go and earmark to health to support universal healthcare coverage agenda. But if you look at how sin or excise taxation or sin taxation was implemented in different countries or region, despite the evidence is the same, but they've used it differently. Why? Because in some countries, maybe there is no law for earmarking taxes for health. In some other country, they don't want to unify public funds because of political system, etc. So understanding the political economy of how decisions are being made in a certain country would allow you to identify the right opportunity to pitch that evidence in the right way. And this is exactly what Tanya and Davi mentioned, that understanding that context is very important, okay? The way, even if you have the same priority, preventive care, you know, in Malaysia versus Indonesia, I tell you, solution will be different. Although the problem is the same, but context matters, and that's very important. Third, definitely ensuring sufficient time for the preparatory phase. Again, it's very don't overpromise stakeholders that you're gonna do a lot, because I tell you, I'm talking from experience. The minute you say I'm there and I'm gonna give you solutions, you're gonna get a lot of requests, and you better be prepared. So unless and until you are prepared, don't tell people that I'm gonna give you solutions. So it's very, really, you know, this is very important because, you know, the most important thing in this entrepreneurial type of approach of working with government, and I mention entrepreneurial because it is entrepreneurial. Policy entrepreneurship is very important in how we, again, use that method to pitch that evidence. But the most important thing, part of it, is establishing trust. This is very important. And the minute you overpromise and underdeliver, you lose trust of governments, or at least the policymaker you work with. So it's very important to make sure that you are well prepared to that. That's why I think in this workshop, we're gonna support and build capacities of teams and hopefully train the trainers in terms of how they move forward. It's very important to make sure that the team there's a core team, people that are really leading, clarifying role responsibilities, work plan, timeline, all this will be discussed this week, but also understanding context, as I mentioned, and the framing of the problem, how we are defining a problem. Are we defining the inequities, correct me, Professor Yod, if I'm mistaken, the inequities when it comes to access as part of universal health insurance in Indonesia, are we defining it because of capacity issues, the resources issues, the resource constraints, or demand increasing, or a competing private sector that is emerging in Indonesia? It's really, it all matters. It all depends on how we are framing the problem, because if we frame it in the right way, in the way that is catchy for policymakers, this is where we can actually find the right evidence. So the more specific you are, the better identifying problem. Allowing sufficient time for defining the scope, and of course, and this is part of the coaching and mentoring with the template that we're gonna be working on. The one thing I want to mention is that, you know, it's demonstrating success. So basically, it's very important to move from a leap of faith to a real success stories. People are, you know, get attracted and they build faith in you and trust when they see outcomes, okay? So my advice and for the teams that they will start working on that. So again, develop the concept, develop the product, test the product, but also measure the impact of the product. That's a nice story you can tell about. So for example, in our case now in the region, I can tell you, you know, highlight the number of laws that we were able to impact in terms of issuing. Now we are working, supporting government in the universal healthcare insurance law, the draft bill. We are actually now on the decision-making table in the parliamentary subcommittee that is drafting that law. But this took many years up until to become a trusted source of evidence. It's very important for IFIPNet teams and knowledge translation team to become a trusted source. Meaning if I go to you, I trust that I'm going to get an objective and neutral evidence-based advice on the solution. It takes time to build that trust, but that's the way to go. And that's what we've learned from many IFIPNet teams across many countries. So that's why I'm not going to talk much about that, but briefly, though, this is a center, K2P Center, which is, we are proud that we are a WHO Quebec Center for Evidence-Informed Policy and Practice. Thanks for Tanya and WHO colleagues for the support. So this is a center that was officially launched in 2015. We've done some, but the one thing we have done about this, we have done some soft launching. So we didn't create the structure and we went to people say, oh, we have a center now that give you evidence. We started with them 1 year before the launching. And we've actually demonstrated the value of evidence to policy. That's why everybody was rallying behind creating a center for that. So my advice here as well, if you want to go into become a structured approach to this, make sure you also have at least a demonstration of the value you are bringing to government. It's very important. That's why identifying 2 or 3 priority topics, doing evidence report policy, doing a policy dialogue, you create a momentum. You create really, and people will rally behind you. They will say, so now I know what that means, that evidence to policy thing. Really, so it needs to actually be practical. So we've actually created this, and we are happy that we supported many regions, many countries, many teams around the table. We have different products in terms of this. So policy brief is exactly the same evidence report policy, which include options for consideration. We have briefing notes. Some policymakers, they prefer, give me a recommendation, evidence-based recommendation. We scaled up as part of COVID-19 to rapid response. So we have a rapid response. We have a when we influence the salt fluoridation law, we've done that in 3 days. We have now formula 3, 10, 30. So sometimes government are so pressured. 2 weeks ago, we were really overwhelmed because the government was actually approving the budget for 2024, and we wanted to influence the resources that's going to health. And luckily, with the support of Ministry of Health, we were able to get what we wanted as part of budgets. But all this through rapid response system. In COVID-19, we've used it as well. We have a product for media. I don't know how much influential media is here, but we tried to actually also help media, use evidence in the right way to bring public support to decisions, etc. So we have different products when it comes to this. And I think one of the things that I wanted to mention, and this is exactly the approach of IFIPNet, every time we start, whenever we do something, we start in a backward approach. We start by the impact we would like to achieve first, and then we go backward to see what would be the best to achieve that impact. So my advice to you, when you look at problems, think about ideally what is the best case scenario, worst case scenario. And this is how you strategize, how you are using IFIPNet tools. Do I need to do systematic review? Do I need to do evidence synthesis? Do I need to do evidence report policy? Do I have a lot of data and evidence that I can harness? Mind you, most of the problem in health and the social sectors, there's a humongous amount of evidence out there. So the excuse that government always say, oh, we don't have local evidence, we don't have a lot of evidence. Well, if you dig deep, sometimes you are data-rich, information poor. A lot of data, but nobody is making use of that data. So the question, and I think going to what Davi mentioned, Tanya, that how you can triangulate local data, evidence, with regional data and evidence, with global evidence and systematic reviews. How you bring them all together in one statement. Policymakers don't like to read. I'll give it to you from all. If you send them a document, 20, 30 pages, you're lucky if they read the first 2 pages. I don't know about Indonesia, but I'm talking from my experience. Which means we'll put a lot of pressure. How you can actually be so concise and action-oriented, okay, and use the right metrics to trigger attention from the first 1 or 2 pages. And we'll talk about it in the workshop in terms of. So impact is very important. Don't do this just as a proof of activity. Use it as I want to show impact, even if it's small impact, and then you can start the engine. Once you have impact, you will have confidence in your team, and people will trust your process, and you will take it to the next level. Okay. Again, a lot of examples. You know, in Lebanon, we have the Syrian refugee crisis. We brought all the stakeholders. We actually engaged them in, you know, we told them, tell us what is your priorities. Tell us what are the problem you are facing, because we want to join hands. We don't want to parachute solutions over your head to a problem that is not a priority. So I'm not quite sure here in Indonesia or others if you do a periodic priority setting exercise. You engage with government, you do this type of, trust me, these are valuable exercises. You would learn, because sometimes I've seen a lot of politicians that they always say, oh, I don't trust academia. I don't trust those people that are sitting in universities because they are speaking different languages. I don't know what the case here, but I'm happy to hear from you, but I've seen that. So reaching out to them it's very important. That's why I told you don't eat your lunch alone. That meaning that you have to go beyond your comfort zone, and you have to have made those cold calls. If I tell you how many times I failed to reach out to certain politicians or policymakers, like many times, but you have to keep persistent. There's always a way to get there. And by the way, one of the things that I learned over the last many years is that the best way to get to a senior policymaker, whatever, is their assistants. Like the, you know, executive secretaries, whatever. This is the best way because if you made this through them, you could easily access them. But I mean that you need to reach out to them, and they will welcome when they see what's in it for them. Don't go and tell them, I'm here to bring you evidence. I'm here to actually understand more your problem, and I want to help you find good solution that is politically feasible. It changed the game. Okay. So this is an example, again, from priority setting to a briefing note, policy brief, to a dialogue, to an impact. A lot of examples, you know, this is related to patient safety. We have a lot of laws that we already achieved. We have the COVID-19 series. In a matter of I would say 3-4 months, we were able to produce 26 products, real time, because, and we were actually supporting, you know, decision makers and the committees that were really involved, among other stakeholders that are really involved. In our case, we have to translate all those products into Arabic because usually policymakers like to read something in their own native language. So what is the lessons learned? I think what we have, at least from our experience, that policymakers and health social system strengthening need to be informed by robust research, evidence, and data. I think we all agree with this. But understanding the context in how decisions are being made, in many cases, by the way, now we do political economy analysis before we do evidence for policy. Now, in this workshop, we'll show you how to do this type of political mapping, policy context mapping. Trust me, it's very important. Who are the players? Who are the stakeholders? Who have the power? You know, what are their priorities? Don't underestimate that. Doing the legwork before you start, trust me, is you're securing more than 50% of your success. Ensuring the 3 rights, right priorities, right timing, and right framing. Very important. So, and I will underline the word framing. We'll talk more about it in the workshop. Utilize the range of products and different packages of how we can package evidence to decision makers. And sometimes we do personalized debriefing. Sometimes people, oh, I don't want to read this. So can you, I'll give you 10 minutes of my time. How am I gonna actually take that in 10 minutes? Okay, so we do that. So I think all this are part of this. The one thing I want to underline here is the word you see, and it was mentioned by Tanya, tacit knowledge. Okay, sometimes you have a lot of systematic views, high quality evidence, but it doesn't mean that you get it all. Tacit knowledge is really experiential knowledge, the knowledge that you have in the brains and minds of people that work in the system for many years. You know, sometimes you always hear, oh, this doesn't work in our context. We're not used to do so, whatever. Well, you better listen to those people that tell you this, because it tells you whether your solution will be implementable or not. We'll talk about it more in the workshop. You know, creating demand and value, you need to create demand for your product. That's why it's entrepreneurship. You need to create demand so it become institutionalized. Tanya mentioned a very important word, institutionalization. over the last many years, and this is maybe one of the lessons learned from IFIPNet, we used to use policy nudging. We used to nudge. You know, oh, you should use this evidence, you know, before whatever. But policy nudging is good for a certain period of time, but if it doesn't become institutionalized, it doesn't work. So you need to nudge. And you know, lately, I mean, for a fun example, I don't know if here in Indonesia, but over the last few months, I've been traveling many countries. So now when you go and pay your bill, like you give them credit card, right? And you know, well, go to a restaurant, whatever, and that's okay, this is a accept. Okay. Suddenly it gives you the screen, okay, you wanna put 10% tip, 15% or 20%. And this is nudging, but it's become now as part of the structure, meaning, okay, oh no, I'm gonna put whatever, 15%, whatever. It's become structured in the system. The question is, I know it's a completely different, but the question is how we can actually bring evidence to be structured and to give the right prompts to decision makers, exactly like the nudging of the 10% or 15% tip. Okay, it's not happening. And we don't see this as part of the accountability system and political system in many countries. So that's why when I say institutionalization, we have to take it to a certain level to say, look, you have to say, if you're not gonna give me the 10%, you better press that button because I'm gonna hold you accountable because you didn't use that evidence at that right time. It's a completely change in the ball, you know, it's a different game that we're getting into. But when I say institutionalization, now we have been working for the last few years to convince Parliament to have a manual in the Parliament of how to use evidence, integrate, whatever, and there's a lot of political resistance. And to me, this is still not structured, not institutionalized. You need to bring it there, but it's there. So that's why creating demand and value for the use of evidence, through sharing success and impact stories. Would love to come to this region maybe 1 or 2 or 3 years and hear more and more success stories from this. What do you think, Tanya? I think we but I think it's very important. So my advice to you, all the work you're gonna do, please document it and demonstrate it through impact. Or at least through sharing lessons, engaging stakeholders throughout the engagement process. That's why now in the new initiative, GAP, the Government Engagement Platform, we call it Engagement Platform. So we're making very clear that we want to actually be serious partners to engage. Be ready to provide rapid response services. I tell you that, you know, my advice, don't go so fast into rapid response. It takes time. It takes time. Build capacity, start small, and then again, turn your engine of growth to the level where you can come to become, you know, a go-to entity for rapid response, okay? But don't tell stakeholders, oh, I'm ready to give you something in 2 days. No. Build capacity first and then go to that. And of course, always measure your impact. It's very important. Even if things doesn't work, it's also a lot of learning opportunity. So let me by just maybe before I finish, just to mention that there's always barriers. There's always barriers to use of evidence. You know, okay, we're talking about this, but I have to tell you that, you know, if I were here 10 years ago, I wouldn't be speaking what I'm saying now, because we've learned all this through the hard lessons, to be honest with you. But certainly these things, we always find that. And this is work that John Lavis have done, and this is published, but this is really maybe applicable in many contexts. Some of the challenges of linking data and evidence to policy, that sometimes, you know, evidence is not valued as an information input. So how we can make it really a requirement? No, we are now into a new era. We're now into ChatGPT. We are now into artificial intelligence. We are now into making quick decisions more and more and using whatever data is available. That's the challenge. That's the space where you have to understand and navigate. Research isn't relevant. The question that I think from a producer of knowledge, I think many of you are researchers working in university and beyond. Are we producing policy relevant research? It's very important. Meaning, you know, many times, like in my university, I don't know here in Gajah Mada, but I think in my university now, as part of the promotion of faculty members, you don't only need to show how many publications you've done per year or impact factor, which is important, but you have to show impact. You have to identify what are some of your publications that led to impact. So it's very important. Research isn't communicated effectively. Sometimes, again, policymakers like to hear the music, not the noise. It's so easy to go out there and say, well, things are not working, government not doing their job, these are the problem, whatever. This is the noise. They are hearing about it. What they want to hear from you is the music. I'm here to give you solutions. I understand your context. I understand how complex it is. But I'm giving you an approach of how you bring solution that can be impactful and sustainable. They will hear you. They will hear you. Research isn't available when policymakers need it, and that's why it's very important to actually bring, knowledge translation platform has an important role to bring something to the agenda of government. Sometimes, there are priorities that nobody's talking about it. But once you nudge it, once you push it into the agenda, that's why we work with media. We strategize what information can go to media so it can influence decision makers. Policymakers are attentive to media, you know that. Now, social media, not only print media and TV and others. Policymakers lack forum where challenges can be discussed. Many countries now are going into One Health, the One Health approach. How we can look at human health, environmental health, and in more of environmental, animal, and human, but how we can make sure that we align our policies across all those. If we want to speak about One Health, what that means. Okay, so meaning, sometimes, stakeholders are not around the same table when they speak about those issues. That's why when we talk about policy dialogue, are you bringing the right stakeholder around the table? And you will see in this workshop, we're gonna show you how much time and effort we put to make sure that the right stakeholder around the table. Don't bring policy takers, bring policy makers. Don't bring decision takers, bring decision makers. And it's one of the nice things about those forums, they hear each other. They hear different perspectives, and they see how they can collectively work together. And sometimes there's no, again, mechanism to prompt them to use evidence into policy. Again, all this, we found solution over the last many years. Research isn't valued as an information input. That's why now, reflecting on the example, the proof of concept, okay? What is your value proposition of being a regional center here? About what are you trying to do? How we are communicating it? How we are making sure we understand the needs? Priorities and needs of government change. Now, my understanding with this new election, there will be a new platform. I don't know about the Indonesian politics, but I tell you, there will be a new political agenda. There will be a new promises that will be giving to people. And so needs are priorities are important. Am I catering some of the work we're gonna do in KT to support those needs and priorities? Very important. Remain objective, truthful, and politically neutral. The worst thing you can have when knowledge translation teams become biased. That's why we'll show you how important to stay neutral and objective and speaking truth to power by evidence. And of course, sustaining credibility and accountability is very important. The barrier related to research isn't available. Well, now that's why, EVIPNet, we promote the concept of conducting priority setting exercise. My advice to you is that for the people that is taken forward this, conduct a priority setting exercise. You will learn a lot, and they will love it. You will see that you will identify. I always tell teams, if you want to start small, conduct priority setting exercise and say, in the next year, I will work on these 2 topics, 1 or 2 topics, that's it. I'm not gonna solve the problem of this whole country. I'm gonna focus on 1 or 2 topics. Be practical, be a little bit more impactful in terms of this. And of course, from priority setting, engagement, and doing all those types of things. By the way, we're gonna go also, all what you see now will be covered in this workshop. I'm not gonna speak a lot about that, but we'll talk more about it. Sometimes we don't communicate evidence in the right way. So how we can make them, let them hear the music. Again, this is the evidence review policy, the policy dialogue, how we are communicating this. Sometimes, research isn't available when they need it. So that's why you will see in this workshop, we'll show you there's a one-stop shop databases. If you have 10 minutes and you are challenged to give the right evidence or high quality evidence to policy, where do you go? In 10 minutes. Now, if you tell me you go to Google, I will finish here and leave. No, but there are some databases. It's a one-stop shop. It's a hub. And they are made for busy people, for policymakers, research that busy, they don't have time to read all the articles. you know, all the systematic reviews. What is that one page I would read? What is the most effective intervention to integrate mental health in primary care? I tell you, you don't, well, there's more than 200, 300 studies, but you might get 1 or 2 pages from a summary of a systematic review on this that was published recently. It's more than enough just to tell you where the evidence stands, okay? And sometimes, again, the LAC forum, that's why I mentioned about the policy dialogue, is very important. And we'll talk about the strategies of how you can actually, and the mechanism to prompt, as I told you. You know, there's a lot of countries now. In Mexico, there is mandate legislation to incorporate, you know, research into policy. When I worked in the Ministry of Health of Ontario in Canada, we didn't have a mechanism. Now it's a requirement in the government of Ontario that you need to actually show and use at least 2 databases to show that you have looked at 2 databases and you use evidence before you actually, you know, bring recommendation upstream to a minister, deputy minister, or so. In Malawi, also Ministry of Health Parliament now developed guidelines for user evidence making policy, etc. So the question is how we can make this as part of the cabinet submissions, about the in-ministry submissions, any policy, any recommendation, and this is part of the institutionalization that we have been talking about. So again, I'm gonna finish by this in terms of our region, Eastern Mediterranean region. What are some of the barriers and facilitators? And we published that. We've done this, you know, even before we launched K2P, because we wanted to show that we know what are the issues. And you will see that, you know, when we surveyed more than 250 policymakers in 14 countries in the region. We've including ministers of health, former ministers, etc. We surveyed researchers, but you can see that, you know, most of the policymakers, they mentioned that, you know, they want to use evidence. When we ask them, okay, what type of evidence you use? Rarely they refer to systematic reviews or single studies or high quality evidence, mostly about statistical report, data is coming from the ministry, projections, etc. But at the same time, one of the things that, you know, we've already heard, that some of the key barriers to use research evidence, lack of administrative structure, no structure in ministries, limited value given to research, lack of research targeting policy, lack of funding, lack of trained policymakers. That's why now we train a lot of policymakers to ask the right question. Political forces. Some of the frequently reported facilitators, availability of health evidence or data, availability of research institutions supplying the evidence, communication and networking, qualified researchers, funding, easy access to information, which is now happening. And some of the strategies to promote the use of evidence, increasing funding and investment, producing policy-relevant research, building technical capacities, and increasing communication. All this, and I say that although this is coming from our region, but I tell you that this is applicable to many regions. But I would like to hear, maybe before we finish, hear from you about some of the barriers and facilitators that you already have in your context. This is again some of the work that we are doing. We've done a lot of work on even we mapped out all the type of research evidence that is coming. So we've done matching and mapping. We looked at all the priorities of governments, and we looked at all the research production in the region. We realized there is a mismatch, okay? So people are producing evidence in here, and the problems and priorities are somewhere else. So how we can do that matching and alignment, I'm not gonna go into this, but just to show you that there are a lot of challenges when it comes to this. So this is my last slide, and this is a question to you. Sorry, I took, I think, more time than I expected. But I think the question to you, what are, in your opinion, based on what you have heard from the 3 of us, what are some of the main barriers to using data, evidence in a structured way in decision-making processes? What are the barriers, and what are the facilitators? I don't know if you can give us, moderator, if you can give us at least 10 minutes maybe to have a reflection from the floor. I know we will discuss this more extensively in the workshop, but I think it's good to actually maybe start planning for that workshop by actually asking this question. Based on what you have heard, what are some of the barriers and facilitators? Not necessarily in Indonesia. I mean, you can reflect in Malaysia and others, but it will be good actually learning opportunity for us. Over to you.
Thank you, Fadi. That was really extensive explanation of the circumstances surrounding not just the evidence, but also how we would you would say of how they would accept kind of our findings, evidence findings. So over to the audience, who wants to chip in on what are the barriers and facilitators EIP in your region, maybe in Indonesia or Malaysia?
Or maybe if you want to tell us success story. I mean, if there is something that you thought maybe there's some work that has been done, and in fact you've seen it materialized in decision making, I think it's good to reflect on that as well. And it's not only the barriers, it could be successes as well.
Anyone?
Yes.
All right, thank you. So perhaps this is both barrier and a bit of success story. So I work at the Center for Health Policy and Management, and so I've been working for only about 3 years. So I'm in my early career, and to my observation, since we are situated in Yogyakarta, which is not the capital of Indonesia, it's quite challenging to create the momentum, particularly to engage with the central government. If you're in Jakarta, it's just within driving distance, but if you're in Yogyakarta, you have to take a flight. So I noticed that to engage with the stakeholders, we have to set certain meetings, online and offline, that of course require a lot of resources. But so I learned from my seniors, and I think they also are aware of such challenges. So in order to create the momentum, we produced several webinars for free about several different topics, and apparently such webinars were being noticed by the central government, and they take that as a sign of cooperation and stuff. And from that point, we've started working in more intensely with the central government based on such webinars. So I thought that well, creating a momentum doesn't necessarily have to be directly reaching out to them, but also creating an event that perhaps gain their attention. Thank you.
No, I think this is a great example, and in fact, you know, there's a different way. There is no a cookbook of how to do that. But I think what I understand from you, that in fact that engagement that you have done through webinar so is actually triggered attention. So you've done something good here and something successful. I think the question really how to sustain that. How to sustain that interest. And I think the learning we got from IVPNet is that sometimes, you know, windows of opportunity in government is too short. So you need to make sure that this is really keep consistent and sustainable and scalable. But I think this is a very good example. One thing I want to mention about the region versus central government, I agree with you. I mean, Indonesia is a big country. I mean, regional priorities might be different than maybe the priorities coming from the central government. So it doesn't mean that, you know, successes at the regional level is not important. In fact, is as important as the central level. I think we've seen that in Nigeria as well. In, you know, some of the state where there was some successes happening, but then they took it at the central level. So all this what's happening, even you can think small. You can, you know, think big and act small. That's fine. You know, eventually it will reach up there. But I think that's a good, very good example.
Okay. Anyone else from the audience?
Hi, thank you, Prof. Fadi, for your very extensive explanation. So my name is Rama. I come from University Malaya. I've been in the academics, I think, since 2021. So prior to that, I was with the Ministry of Health, and I think I had a short stint as being as a policymaker level itself. And mainly, I think what I understood is in Malaysia, I think we've had a change of leadership with regards to the Minister of Health. I think we've had 4 ministers in the span of 4 years. Yeah. So I think the main issue was when I was being at a policymaker level. So prior to that, I've been in the Ministry of Health for a long period of time, but I was at a policy implementer level. But when I was at a policy maker level, I realized that it's not so easy as, although you're part of the system, and it's hard when there's a change of leadership because it makes a lot of difference. And I think during that time, so we've had a lot of experience as using evidence to actually produce tailor-made interventions to improve health as well. But when there's a change of leadership, it takes you in a different tangent all the way. Yeah, thank you.
No, it's a good point, and I have to say that I've worked with ministries before, and there's 4 levels of ministries, and with time I realized that sometimes you might have better influence even if you work outside the ministry, not necessarily in the same ministry. But I think in this case that's the importance of networks. Does this ministry link with the right stakeholder and partners, particularly, for example, knowledge translation platform? This is a problem. It's an inherent problem in policy, is the constant turnover of politicians and ministers. If you put all your eggs in the basket of one minister, it's a lost battle, because things will change, priorities will change. In fact, you will be branded and labeled that you were pro that person. So don't do that. That's why neutrality is very important. What we have learned over the last many years: build sustainable relationship with bureaucrats. Bureaucrats stay. Public servants play in government. They don't change with ministers. Really, this is very important. Like, much of the success that we have done actually by collaborating and partnership with the Director General, which is this is a position that never changed up until they go to retirement. So, and their teams. So it's very important to who to partner with within the institution. Of course, you want to influence people at that level, but you want to create sustainable capacity as well. So the question is that linkages between ministry and knowledge translation teams and teams that are working on it's extremely important, because this is the type of relationship you want to do. The other one to mention that in knowledge translation, my advice: don't only put all your efforts only in Ministry of Health, with all the respect. But I think with time I realized, and don't quote me on this, that with time I realized that one of the main barriers to health is ministers of health. Really, because sometimes they don't see, particularly now when we talk, I don't know in Indonesia, but in my part of the world, health is beyond Ministry of Health. So it's not only Ministry of Health. There's many public funds, many ministries involved, etc. So now our work is to engage many ministries at the same time and have put the right pressures and advocacy. But in some other countries, I think the Ministry of Health here is very powerful, because you have universal insurance, so maybe my example does not apply here. But really make sure that you engage with the right institutions that are active players in the system, and invest in public servants, in bureaucrats, in policy implementers. Those are your allies. These are your network. They are, and trust me, street level bureaucrats sometimes are more powerful than minister. They can make it or break it, if implementing decision or so. So it all depends. That's the beauty of power mapping, and we will discuss this in the workshop of how to do this context mapping. Who are the players? Who are the stakeholders you want to invest? I think that's a very good example. Thank you. I think we had a question as well here. Also, yes. I'm sorry, I'm taking. Feel free to respond. I'm just.
Okay. Thank you. So. Maybe one of the facilitators, as mentioned by our colleague, so Indonesia is a decentralized country, so we have national government and local government, and one of the key facilitators of the government willing to uptake the policy is to engage those who are in charge for the money. So because we are in a health sector, but then there is another agency that in charge for the money and the planning. So when if in a stakeholder engagement meeting, we include them as well, and they have a good concern about what we talk about, so they will uptake the recommended policies. And I think the barriers is the competition between health topics. Like we know that the international agenda has the HIV, TB, malaria as the priority, and they become the priority of Indonesia as well. But then there are another topics like maternal and child health. So sometimes these are competing, and it really depends on the government which of the policy that they need to take, and often it's influenced by the donor as well. Well, which donor brings more money, they can smoothen the process of evidence policy. Yep, thank you.
So the first part, it's interesting about in the work we do, we engage a lot with Ministry of Finance. So much of what we do now, we have somebody from Ministry of Finance, because there's a lot of technical issues, even people at the Ministry of Health don't know. So you need to make sure that you link with that group in terms of this. The one thing about the donors, again, from our region, we are very much donor dependent, unfortunately, and sometimes teams like Knowledge and Team need to engage with donors. You could play a very important role to shaping the agenda of donors. In fact, to where the priority should go, where the investment should go. So your stakeholders, not only politicians, not only Minister of Health, is really across the board, depending on priorities. So I don't know if Tanya and
yeah, maybe just to add to this really different perspective that you now added with mentioning funding agencies at national level. So while we do promote through the power mapping and the situation analysis that we're going to speak more about during the workshop as a starting point for then further developing the evidence to policy infrastructure at country level, what we have not so far done yet at WHO level is actually bringing these funding agencies, these national funding agencies at national level together at a regional, global level. And I was just last week, in fact, in Bangkok at PMAC and at the Prince Moiwol Award conference, and the Ministry of Health of Thailand suggested that would be an important gap that we could maybe as WHO close, meaning providing a convening platform for national funding agencies to exchange, on the one hand, their lessons and in that sense inform each other, but also for WHO to use this convening platform to further promote the evidence to policy agenda. Because if the funders really understand how important evidence-informed policy making is and invest into that field, we are going to have a very catalytic moment. So a very important point that you mentioned that we are looking into taking up more strongly in the near future.
Okay, maybe we can move on to the Q&A session. Okay. Does anyone want to ask the first question regarding from all the presentations from the beginning, from EVIPNet to evidence-based policy, evidence-informed policy? Yes.
Thank you, and thank you for the opportunity to attend this discussion. I'm Habibi from the Center for Tropical Medicine, and I want to ask a question on policy. In our discussion, we discussed that the evidence is needed for a policymaker to create regulation, something like that. But the situation is when we know that in some country or in most countries, the politics is not for long period. I mean, maybe for example, in Indonesia, every 5 years we change the government structure. That may change also how the Minister of Health and the other ministers will lead the health program. And in your opinion, how to make a sustainable or long-lasting evidence-based to let's say to work with the policy more sustainable? Thank you.
Well, I think we all have some answers to your question, which are though not a blueprint approach that we can suggest, and it was already beforehand alluded to in Malaysia as well, a similar problem when you have a turnover of government. How do you ensure that nonetheless some of the maybe already established structures and mechanisms that allow to use evidence and policy, how to maintain them? And one way is really targeting those in the bureaucracy that are not affected by the turnover. Another way is looking at creating partnerships also beyond the ministries and ensuring that you have more of a culture at country level that is being developed, where accountability for using evidence in the decision-making process is wider spread. So even if there's a turnover in the government, other actors will claim that the use of evidence is being maintained. That's one aspect how one can further promote, even beyond the duration of one government, the use of evidence. I mean, we have seen in Brazil, and Davi maybe can say more about that, how during the previous government in Brazil, there was the use of evidence was at national level really dismantled, right? But then if we go to the lower levels, because it's also quite a decentralized policy-making process in Brazil, how their mechanisms were still maintained. That's one aspect. And also how the use of evidence in areas such as health was much stronger, because there was a culture developed that you cannot break so quickly as in other areas such as in environment. So it goes back to the institutionalization. If you have a country where the maturity of evidence use is further institutionalized, then it cannot be changed as quickly as if you have a country where you're just initiating the process of evidence use, and if then there is a decree or the government decides, well, we're going to completely change, but you don't have the different other components. We have identified 6 components that are essential for institutionalizing evidence use. If these are not yet in place, then the resilience of the institutionalization process is much weaker, and in that sense cannot be maintained in the same way. So it's a longish answer to your question that one needs to basically look at putting different elements in place, allowing for the institutionalization to happen, and the stronger the different elements are, the more the likelihood that even with a turnover in government, which is only one of the factors, you can still maintain processes. Yeah, and what we're trying to do, in fact, during this week is looking at how can we put different elements in place, how can we assess the situation first and foremost, but then also embarking a journey where the different elements of institutionalization are being strengthened, so that again, the risk of deinstitutionalization, which is always there, affects the system to a lesser degree.
Thank you.
But David, do you want to say a little bit more about the case, for example, in Brazil?
Yeah, I think the Brazilian experience shows a bit the challenge that we're referring to, because we naturally, with the political cycles and the differences and the bouncing around the political parties and values, this clashes with the process of institutionalizing evidence, as Tânia was describing. And I think the experience in Brazil kind of shows that we don't have a silver bullet, and we're really talking about like field building, right? So we're talking about a change in culture in government and in society as well, so that the value of using evidence for policy becomes something that is recognized and like taken care of, and something that is advocated for among many groups, pressure groups, so that when there is a change in government, that maybe a new government comes and it's not in line with those values, they receive pressure from different groups, and they are to some extent cornered, or this institutional process are protected from this type of interference, right? So in Brazil, what happened was the new government was advocating for many policies that, especially in the health sector, that were not evidence-informed, that were not evidence-based, and the bureaucratic infrastructure that had been built before was able to resist, and that's because the central government was, it's not all powerful, right? They need to comply with the legislation, and they need to negotiate with the different agencies and the bureaucrats, and like in Brazil we have a federal system with independence in the state level and the municipal level. So all this infrastructure, as we move forward in developing a culture of evidence use and this strengthening this field of evidence use, this infrastructure becomes resilient. And even though, of course, it is affected by this policy changes or this political changes in the political cycle, and you might have like some backgoing for a while, that doesn't destroy the system altogether. Like the system is still there, and once you have a new cycle in the political system, this can grow again, right? So I think that, again, we don't have, unfortunately, like this magic wand that will be just transforming the political system and the policy-making system into a very effective, results-oriented, evidence-based system. But we need to use all these tools that we have and these strategies that we have mapped, and VIPNet has been doing this great work of systematizing all this and making it available and doing the capacity building, so that we leverage all these tools to advance the field in the country, in the different countries, in the regions, so that this is a new value within the political system, within the policy system. And through this value, this new value, we're going to be advocating for more effective policies, more precise, more rigorous, more technically sound policies. And that is going to be the anchor that protects the system against these threats, right?
Thank you, Devi. We'll take the next question.
Thank you. I guess perhaps somewhat relating to what we've been discussing, I'm curious now in the current climate where there is so much that is being tied to the ideologies of the day, whether it's very conservative ideologies or very liberal-leaning ideologies, where even research findings in academia are being swayed one way or another. How does that affect the adoption of evidence into policy when even in academia, supposed research findings that should be objective, that are produced through objective scientific process, are being swayed one way or another, censored one way or another, depending on the reigning ideology of the day?
No, definitely it's interesting question. I think to me, my answer would be this is another reason why you need to have a trusted source of evidence in a given country or a given context, a different region. I think we've seen this, to be honest with you, mostly during COVID-19. I mean, I'm sure you've realized, how President Trump used, for example, dealt with COVID-19 in the US. There was really, a lot of issues related to how we're using the facts, tweaking the facts, infodemics, and we've seen that in many countries as well. And you cannot dissociate this. It's health at the health is political at the end. I mean, we're not changing that reality. I think what is really important, and that's why, knowledge translation team, entities, structures, institutions, organization, they have a lot of leverage, sometimes is underused. And in fact, I would say even more, that many academic institutions, unfortunately, are not really optimizing their role to bring societal benefits. And to do so, you need to actually have those trusted sources of evidence where they frame issues exactly based on evidence. I think one of the challenges when we have learned from COVID-19, there was a lot of misinformation. And misinformation was not validated by institutions that should speak clearly about the level of evidence and what are the interventions that should be taking place. So my answer would be that we cannot change political systems, but we can work within the political system to ensure that there is some kind of structure to channel evidence at the right time in the right way. I like what Devi mentioned as well in terms of the pressure groups. Don't underestimate that, because I think sometimes you could do a much more impact, not necessarily by talking directly with government. You can use the proxy to get to where we are. We use a lot of proxies, pressure groups. Now, for example, in the government, we assess political statement, ministerial statement. We look at this, and we publish report to show, look, the government promised you this. This is what has achieved after 2 years, and this is the gap, and this is what the solution should be. you know, sometimes you channel it through proxy. The pressure group can be an important influencer sometimes of shaping, correcting some wrongdoing or so.
Yeah, maybe to add to what Fadi has already elaborated on, but credible intermediary means also neutral, right? You had mentioned it in the slide, so that we position ourselves as knowledge intermediaries being really neutral. That provides the credibility and hopefully also the trust. But then the second point is, and we have seen that in Estonia, where an evidence brief for policy was developed to address the major problem of obesity. So it was all about reducing sugar-sweetened beverages. And as an evidence brief for policy it synthesized the best available evidence and promoted then certain policy options such as a sugar tax, etc. What happened is that the industry was not particularly happy about this evidence brief for policy, which got adopted by Parliament. And what they then did is showed their own studies, which showed that this was not effective, etc., etc. So what we were able to demonstrate, because we had the synthesis of evidence, it was basically like a shield against this one study that the industry had provided. So again, if we go along the knowledge translation approach, which is not looking at single studies, but at a synthesis of the available evidence, then we also present more rigorous, more credible, reliable evidence that can then counter against this one biased, ideologically or market-related biased results.
Can I just add one thing? I think maybe one important aspect to consider is that when we are doing policy, we are always dealing with social values, and we are always informed and based on social values. And that is also going to be in the background of any research effort to inform policy. And I think it's very important for us that are doing knowledge translation and evidence-informed policy to be very mindful, analytical, and transparent about this. So what I mean is, for instance, if you think about an economic policy that is trying to increase GDP, that it has as a backdrop to the policy that GDP is the most important thing, right? And maybe that we are not engaging sufficiently there in a discussion about what type of country we want to develop. So GDP doesn't reflect well-being, for instance, doesn't reflect necessarily health. It doesn't reflect community building. And we might have many policies that increase GDP while deteriorating life standards and life quality, right? And that's the case for any social policy. So I think it's really important that we take some steps back and reflect on what is the vision that we are trying to promote. And this vision is value-based, right? It's not empirically based. It's not something that is objective. It's something that as a community we build together, and that's the pathway that we want the country to move forward to. So as we develop this vision and we make it explicit, then we can go back to the evidence and go back to the research methods to understand, okay, so where are we now? And what indicators, what variables, what key factors we need to assess and measure so that we know where we are in comparison to that vision. And again, the choice of these indicators is value-based, right? Because it is informed by where we want to be and where we are. And then assessing what might be the best strategies, interventions to get us to that place. Again, that place is a moral place, an ethical place that has been debated and agreed on through democratic or social process, right? So I think it's really important that we don't naively think that research is just a completely independent process from social morals, social values. It is actually deeply infused, and we need to be transparent and analytical about that so that we can differentiate. So, for instance, a very practical example, in Brazil we were having a few years ago debates about firearm regulations. And although you can have a very practical, empirical approach to it, so let's see what are the impacts of different regulations of firearm control, there is at the back of the debate that there was a difference among the social groups that were in tension within the debate. One group was advocating for liberty, the other group was advocating for security. And that clash in values cannot be solved by the research, right? You can show a trade-off. You can show, oh, we're going to be reducing a bit of liberty here and increasing security, maybe, and that's what the research was showing. But you cannot solve through research the difference in values among the two social groups, which is one group values more liberty, the other group values more security.
Take me to the important point here. This is a good example, that when policy change happen when there are three conditions that are really in place. First is problem everybody is agreeing to. All political parties see that this is a problem. Okay, consumption of sugar. Everybody is agreeing with that. Okay. Second, there is a solution for that. So meaning there is tangible solution to deal with this particular problem. So that's the second condition. But the third most important condition is political momentum and values. Do we have really all political parties that really rallying behind this type of solution? If there's no political momentum and the value system is very challenging, take us to square one, is that how we're gonna frame it in a way, how we can frame the problem, we bring actually and align with the existing value system that's already there. That's how the power of problem framing is very important. So this is a very interesting example. And for example, why many countries they haven't implemented tobacco law, banning law? Why some countries they haven't put taxes in sugar or salt or whatever? I tell you, in some countries, that the low middle income countries, politicians are really they are convinced about the problem, but they say, well, look, it will be targeting, it will be affecting, those taxes will affecting the majority of the population, which is really low income countries. Many of the low income people, they either smoke a lot, they maybe eat sugar a lot or whatever, etc., etc. And those are the people that electing me at the end. So I want to make sure, though they are convinced of the problem and the significant problem, but I think the feasibility, political feasibility is a bit challenging sometimes. So how are you going to navigate that? All this part of the political economy of how decisions are being made. I think there was a question back at the, there was somebody that, yeah.
Thank you. Good morning. My name is Yopi. I'm from Master of Nursing Study Program, Faculty of Medicine, Public Health and Nursing, UGM. I just have two questions for all the speakers. First thing first is, in line with the political year in Indonesia, is it possible or is it a good thing if the candidates, even in the legislative or executive, to use evidence as their campaign materials? And if they use that, how we as a citizen make sure that their idea will be implemented soon? The second question is regarding to your printed materials. I wonder how to engage the local community on the community level to involve in the evidence-informed decision making. I mean, how can we make sure that the primary health care staff or Puskesmas staff involved in the evidence-based policy making in the level of the community? Thank you.
So let me just quickly get back to both of your questions and then pass on to my colleagues. The first question, yes, we would like to that anyone at the policy level, whether it's a candidate for the presidential election or someone else, uses evidence in their promises, in their speeches. I'm not so sure in how far the implementation aspect, whether I can find an answer to that. But then going to your second aspect in view of community engagement, we have these deliberative engagement processes that we mentioned. Stakeholders, also citizens is an area where we're increasingly involving directly citizens into the decision-making process. So that would also involve community health workers, because their voice and their lived experience is very important, depending, of course, on the policy question that we would like to address. But yeah, I'm opening the floor to.
Thank you. The first one is extremely important. So we will be, hopefully the tool will be published soon. So in May 22, we have a parliamentary election in Lebanon. So we decided to go exactly to answer your question. So what we have done a political platform tool now, that this tool will assess all political platform and ministerial promises and legislators, and will grade it. So we have a graded tool now, and we have done this to all political platforms, to all political parties, and they hated us for that, because it's the first time somebody is actually going into political statement and showing the rhetoric versus the action. And interestingly, more than 80% of political platform was actually based on rhetoric. only 2 parties that made it, and unfortunately those that were they were a little bit more into evidence-based, they were not elected. That to show you, people get attached to promises and rhetoric more than evidence. That is the community. That's the importance of even more and more creating more demand and building the capacity of citizens, not only for policymakers, to ask the right questions, to hold accountable those people that are giving promises. So anyway, it was really quite interesting finding. It will be published soon, hopefully, and it's already under review now in the article in one of the journals. But just to, it's a game changer, because this is where you start now showing that don't actually make promises about universal coverage, about whatever, etc., if you don't have a plan of action. What is funny about the political platform, when we assess them, all of them, they mention about what they would like to do. Reducing expenditure of medication, free medication card, universal healthcare coverage, etc. But very limited political platform, they showed how they're gonna do it. The problem with policy is not the what you're gonna do, it's about the how. And how much it's going to cost, and by when you're going to do it. So just to show you that I think it's a very influential way. So I like your question. I think this is the way to go. This is the way to go. And I'm sure, actually, few parliamentarians told me, said, Fadi, in 2026 election, trust me, many of the political parties would start really wondering about evidence, because they know somebody will be actually evaluating those political platforms. So I think this is a very important way to go. The second point about the community engagement, I absolutely, and I think it's very important. Now, I have to say, when in the workshop, we'll talk a little bit about part of the work on policy that you need to actually be, you have to do litmus testing. You have to be seeing and taking the pulse of the community and engaging with the community partners to get a sense about, okay, are those proposed solutions a way to go? When we've done something about integrating mental health and primary care, I mean, the evidence is somewhere that, you know, it has to be integrated, exactly task shifting, whatever. But the reality is there was not enough psychologists, not enough psychiatrists, nurses are overwhelmed, and not even task shifting can work in certain communities. What are they gonna do with that? So it's ridiculous to produce a product that doesn't match reality. I mean, the reality is something. So that's why we do this type of engagement and litmus testing, and they love it when you bring actually people that actually in the actual field to actually tell you whether this makes sense or not, and how to actually make a better sense and meet the needs. Those are the people that will make your policy successful or not. Not only the minister that will make a decision, it's actually the people that will implement it. So engaging policy implementers as part of the process, when we say engage policymakers, stakeholders, we're not only talking about the people or the political level and the senior level. We're talking across the board depending on the topic.
Thank you, Fadi. Well, just to add a bit to the previous answers, I think the citizen engagement question that leads to a broader reflection about the challenge that we face in terms of how the system, the political systems and the social policy systems, they don't incorporate evidence so often, and that is because the structure of incentives that is playing in those systems is not reinforcing evidence, right? So very often political actors are not rewarded for using evidence, and what Fadi is doing right now, Fadi's group is doing, is exactly punishing them for not using evidence, and that is creating social pressure. But if they're not punished, or if they're not rewarded for using it, there is no incentive, and they will be doing what allows them to win an election, which is often not necessarily doing evidence-informed policy making or doing the most effective, efficient, and transformative policies, right? So I think the citizen engagement discussion is really instrumental, because it is about creating not only opportunities for one specific policy to be more effective and to bring in that stakeholder who is key for the decision making and the effectiveness of the policy, but also to create social overall capacity and awareness, and like improve this valuing of evidence as a way to create pressure to the system as a whole, so that the actors in the system start to feel the pressure to use evidence, because if they don't use evidence, they will be either punished, or if they use evidence and they can actually deliver impactful interventions, they will be rewarded for that, right? That's the system we want to build, a system where good policies are rewarded, bad policies are punished. And once we get to that system, then evidence use is just going to be automatic, right? We won't be needing to do this pushing for the topic, because the people who are doing the policy will need to use evidence, because that's a requirement for doing effective policy.
Actually, you reminded me about interesting, many years ago I was in Malaysia, and I met one of the very senior policymakers, very much involved in politics. He's retired, but he was just sharing his wisdom with me. And he said, well, look, evidence of policy is great and all this, but up until that you get to a condition where I cannot bring food to my table, up until I use evidence, this is where I can use it. Meaning going back to the system of rewards and conditions, that you need to make sure that this is becoming now conditional. And that this will be rewarding, but it's also at the same time there will be sanctioned if there will be no. And I have to say, many governments are doing it. I gave you example Mexico and Canada and others. It is happening. I think to what extent this will be happening across the board, I think that's part of the movement, hopefully, that we're trying to push for.
Thank you. And we have one last question from a Zoom audience. Maybe because we're approaching the end of our event, maybe we'll keep it brief. Okay, so this is a very good question actually. This is from Dr. Nico Gamaliel from Universitas Indonesia. To all speakers, would you mind to share if there are any success cases of funding acquirement for evidence to policy process? It is still a challenge in Indonesia to acquire funding apart from research and innovation project grant. The limited funding opportunity makes the E2P process become less flexible and responsive to most current policy needs. So, funding.
The funding.
Yeah, I mean, I think we are all in the same boat here. When we have a look at funders, global funders, an emphasis is very much put on research production, and maybe, and increasingly so, which is a new, is a positive trend, of course. There is an add-on that it's not only the research production, but that knowledge translation components need to be considered. But that's, again, not a specific funding then of our activities, our bread and butter. It's an add-on to the research production. I think from what I can see, there is also among the donor community a shifting trend. So for example, at the recent Global Evidence to Policy Summit in August 2023, so last year, we had a funders panel, and we did hear increasingly interest and emphasis on the evidence to policy and action field specifically. There's a funders group, for example, that has been created to look into these processes. But overall, I think it's really very much our responsibility as part of creating a climate and a culture for evidence-informed decision-making to also target funders. So this is why, as I mentioned earlier, to the question on, or the mentioning of national funding agencies, I think it's very much our duty as WHO, but also of other actors, to ensure that we consider funders as a very important actor in our field of evidence-informed decision-making. So that's my maybe not so satisfactory response. I can't point out this or that funder that absolutely will work on evidence to policy. There are, of course, some, I mean, if I were to name a few, like IDRC or Hewlett, that are specifically looking at evidence to policy, but again, it's also limited so far. So we're hoping for a change process to happen. I don't know whether you have anything to add here.
My 2 cents here is just to say that we have made we've came long way, I have to say, over the last few years with funders. So you'll see now much of the call that is coming out there, exactly as Tanya mentioned, there is explicit mentioning that they want to see knowledge translation and evidence to policy demonstration. So now more and more funders want to produce, want to fund, support policy relevant research, and they want to show also some successes or measuring impact. I've seen that even Wellcome Trust now, all those grants, they already have explicit mentioning. The one thing, my advice to the person that asked the question is that it all depends on how you are framing your research proposal. If this is only about evidence to policy, it might not very much, I mean, how to make it a little bit much more appealing to funders is very important. So evidence and policy should be part and parcel of the proposal. But I go back, is really about solutions. Again, also funders want to see that their investment in research is making also an impact, not only by producing evidence and publication, but also supporting and solving problems. So that's why it's all about the framing of those proposals and the packaging of this. But I have to say, there's I wouldn't say a lot, but there is much better funding opportunities now for this type of work more than a decade ago.
Just to add, I think my advice here would be, as Fadi said, like that there is a growing tendency of like providing funds for this type of work, and I think there is a parallel trend that these funders, they are looking for partners in the Global South. So traditionally, they have been partnering up with Global North institutions, universities, research centers, think tanks in the Global North, and now they are increasingly realize that this is not as instrumental as partnering up with the local teams, because the local teams they're embedded in the system, and they have much more leverage because they understand the system better, they have the connections, they will be there in the long term. So there is a tendency of looking for Global South partners. So my advice here would be to start building these partnerships with Global North institutions that are leading this debate, and they are mostly receiving these funds right now, so that Global South organizations can start to show up in the map, and be part of the ecosystem, and show that they can provide good work, they can provide great output. I think that has been very instrumental, for instance, for some organizations in Brazil, as they become part of the ecosystem, they become recognized as qualified and high quality institutions working in the knowledge translation field. They've been able to dispute these funds at the same level as the Global North organizations, and that has allowed some funding to come in. So yeah, I would advise to start popping up in the map, in the radar, right? Like building a portfolio of international projects, partnering up with organizations and the people who are currently occupying this space, so that this networking opens up funding opportunities.
Thank you. Thank you so much for the Q&A answers and for the presenting the topics. We learned a lot today, I must say. And I think we've come to the end of our event. I will give back to the MC.
Okay, thank you very much to all speakers and our moderator. Please give applause to our speakers and moderator. And we hope that this discussion will be fruitful for us. So ladies and gentlemen, we have come to the end of this seminar, but I have some announcements to all of you. The first is, please, you may scan this QR code that will be provided on the screen. You may fill out this Google form as a feedback form for the committee, and this is also one of the terms and conditions to get or claim the e-certificate. Once again, please, you may capture this first and scan this QR code, and please fill out the form, the feedback form, to get or claim the e-certificate. Thank you very much. And the second announcement is for the workshop participants. We will be continuing our activities at Novotel Shoots, and the lunch will be served at the Novotel, and the workshop will be started around at 1 p.m. There will be a car service available to transport you to the Novotel, and please cater, and our team, the committee, will assist with the arrangements. That's all. Thank you very much to all of you. Yeah, we will have a moment to take a picture together, but maybe outside this room after I close this seminar. Thank you. And thank you once again to all of the participants, and we do apologize if there is any mistakes. I am Meta as the Master of Ceremony signing out. Wassalamualaikum warahmatullahi wabarakatuh.